mayam ngasi Singjamei sigi live asida punam putarap nok cheri mayam akhoi Singjamei si lakchari se yamna akhoi gi Manipur da yam kaman oidaba du Manipur khatagi na tabida north da kaman sungoi oidaba mafam ama Singjamei si lakchari maru oina mayam akhoi Manipur gi mapanda Dr. Tamuba Singh haitare Manipur gi mapan foreign country sing da Dr. Tamuba Singh na akhoi India da lakma tamda Manipur lakma tamda akhoi doctor practice tawbase yadabani exam ama thabani mayam na dum MCI exam ka asum khangnabani ko Dr. Tamuba Singh se ado adugi exam si lui hai nei mayam ado mafam sida kari ma lakta di haidi akhoi ming adum panjage AFMCG sida lakta agadi mayam MCI exam haina khangnari ba mayam exam se yam laina pass tawba yagadoi ni ko AFMG haibasi mayam No.1 Academy for FMGE hai ko mayam si je koi gi foreign medical koi graduate examination haibni FMGE hai se aduga chahi kunchida kwaidagi No.1 Academy oi bai ta iram da Manipur se su aduga notice su hai tare Manipur gi mapan dagi su mafam sida student mayam matam no lakli mai pak pai student mayam su puthokre mayam mafam se khoina sum taksa bada koi sigi Hatta gi mayam Checkon ta lambi mayam si pareng sum lambi sidani ko mayam lai se adum mayam sum notice window tv sile ko mayam notice window tv mayam sile re aduga mayam building sigi same building se ni angang koi nupi macha sing or ado thangna badana nupa macha sing tong an separate boarding hostel facilities piraga koi doctors mapana doctor tamiro ba sing sina India da practice tawba yana na bagina makta yamna phaba coaching center mai Singjamei sense recommend tawjaba ado Singjamei si da su myam hangbirakiba koi gi sigumba coaching institute sibu karai da leige haina hangbirakiba dum coaching institute to masidi Singjamei 360 na myam live thajari myam sigi su koina giveaway pizari hai live bingri ba sing sigi su koina code makti thamjadre myam na program sibu share tawbiba han mada ko aduga giveaway ma Singjamei si mai kai dagi pina na hona jage do kari giveaway do hai du myam yam nungai ba announce tawjage loina myam mafam sida lakpiba students sing gi da makta su Singjamei si na video namjarabani na akhanna ba ekoi kai hai ni discount pina na bagtam da same sa do leiri hai ba se myam fam thamjage leiri facility sing se myam library 24/7 na e boys and girls separate hai ba ma guaranteed security hai ba ma separate cabin and locker system hai ba ma lei ko ado myam changmina sigo sigi mafam sida somna kandagi myam changmina ga doini aduga mayam nepsai study zone hai ga su khangna bi bani ko khoi oza Singjamei si ga loina jaduna lai bo oza khoi mayam mang da khoi intro tongna hona jage oza ha ma taram nok chei Singjamei live sida
thank you
mayam oza si mayam dam tang intro dam taw bi oza ahan bagi oina
ai gi ming si Sarwari Khan ko we ai AFMG coaching institute managing director
okay yam nungai oza nepsai study zone se mathaki khoi lariba AFMG si ga dum punra kamai tawi kari service no pb se sai da
si sida pi si AFMG coaching ma pi jare adu dagi khoi library facility pi jare hostel su sida lai jare no pi ni pa gi
okay aduga CCTV coverage kai su happy ko local system aduga khoi gi Wifi spelling ni la lama le highway na isal Wifi access to dum pi ri hai ne 24/7 library su pi hai ko mayam na share yam tawbiri ye sar ngasi gi se ado share tawbiba mayam gi oina su makhoi na lucky winner ama khanga chage ba ko sar hogi mai kai di kari khudong chaba pibi ga doino adum tang thambiyo
share tawba bi singdai khoi gift hamper ama thamjai gift hamper se 1000 rupees ki ojagani
rupees 1000 ki gift hamper ama ado share tawbiri mayam se daw yeng ba yare ne ai di share tawba da sale chang de tawba da bu hoi mayam na share tawbi matam da sigumba Manipur da kwaidagi prestigious oiraba coaching institute ne haiba yare maroina mapanda tamuba Dr. Tamuba mayam gi haita
North India da su ahan boidone
okay yam nungai ado karam ba mioi sing mafam sida lai coaching lo ba se tang thambi
coaching si lo ba lai si Manipur gi mapanda gi su sata lai huju si North India da gi sata phanyam lai Assam da su lai Tripura da su lai aduga Manipur manung da gi mafam location mayam da su lakpi
okay adi mafam se laga khoi service lo ado oza sing se si kamai tawi
oza sing si AFMG coaching institute si Delhi da leiba based over institute amani hai si Delhi da gi la oza na tanani tai si every subject limma ki oza si Delhi da la ga takpi ban
aha oi ta ding ngasi su dum class dum low bro oza kamai tawi
huji su class taw jari huji class taw si Dr. Omkar na surgery ki oza ni India ki afom oza mani la ga huji class law jari
okay ado yeng mina se oza manung da sang mina se ko ado kari facility kamai taw no don mayam tang ut mina se oza mang thabiro sida khoi get chang ba entrance okay sida thong hang do re thong hang do pi re ko mayam khoi chang jarage si thong se hoi lo mu lon sang ra ga di si pura khoi campus sim adum close campus ne dum lo ya re hai si thong se he lon sang gi ba ko hai di student sing gi oi ba tongan ba manung gi oi ba khoi gi environment ama lari ki oi environment ama feel to bangam jare sum na changmin na si ko
ꯁꯤꯗ ꯑꯩꯈꯣꯏ ꯑꯣꯐꯤꯁꯅꯦ
office ꯍꯥꯏꯗꯤ
ꯔꯤꯁꯤꯞꯁꯟ ꯍꯥꯏꯇꯥꯔꯦ ꯃꯌꯥꯝ ꯂꯥꯛꯄꯒꯤ ꯐꯝꯐꯝ ꯑꯗꯒꯤ ꯐꯣꯝ ꯀꯩꯀꯩ ꯊꯥꯖꯟ ꯈꯣꯠꯆꯟꯕꯒꯤ ꯑꯣꯏꯕ
okay
ꯑꯣꯐꯤꯁ
hek changbaga left thang side se leisna office oiduneba okay yam nungai aduga
ꯁꯤ ꯃꯊꯪꯗꯅ ꯑꯩꯈꯣꯏ ꯂꯥꯏꯕ꯭ꯔꯦꯔꯤ ꯂꯩꯔꯦ ꯁꯦꯜꯐ ꯁ꯭ꯇꯗꯤ ꯂꯥꯏꯕ꯭ꯔꯦꯔꯤ ꯍꯥꯏꯇꯥꯔꯦ
okay
ꯁꯦꯜꯐ ꯁ꯭ꯇꯗꯤ ꯂꯥꯏꯕ꯭ꯔꯦꯔꯤꯅꯤ ꯁꯤ ꯁꯦꯜꯐ ꯁ꯭ꯇꯗꯤ ꯂꯥꯏꯕ꯭ꯔꯦꯔꯤ ꯁꯤ
okay library haire L01 ko quiet zone lang ba yadre manung changuragadi lang ba yadre okay table se kya mu leidoino
ꯁꯤꯗ 15 ꯇꯦꯕꯜꯅꯤ ꯊꯥꯔꯤꯁꯦ ꯑꯗꯣ ꯅꯦꯛꯁꯇꯁꯨ ꯂꯩꯔꯤ
sidi pura manung se changagadi chik 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 laure langdre ai pasa ke su yare sona kana su lai ko washroom chu dum nakna leire
ꯋꯥꯁꯔꯨꯝꯁꯨ ꯂꯩꯔꯦ
Anway, langdre. Ado oza sum aina ngasai tajabada oza sigi haidi sidagi haujagi student haitare. Mai pak student am lei haibada.
Lei.
Mati am tang wari sajage.
Ya sambiru.
Adu ne aina am sading isi wari kamai tau wi da moina hairak ko khangdoi di dana.
Okay bon si hanaki coaching sida yaukhiba mai pakhiba chhatra amani
Oh congratulations ai interview haitare wa hang amani da hanjage ko si ai ha ba ya. Ming am tang habiyo ne.
I mean, how long can one this?
Ado kari lam dagi MBBS lo shan pa.
Pakistan dagi lo shan jar pa MBBS se.
Oh 2000 kaya da lo pan. 2021 sai lo shalak pa. Ado mayam na sum generally akhoi na sum tajaba da di MCI exam hoji sida lak matam da di maron do ma oil rem. Hoi adu jo MCI na sum chatla ji kwa. Hoi FMGE gi exam se. Mayam dam lui jo hai nei kwa. Ado lu bana maram orga struggle soi torongani hai na khalle badar kwa. Ado kamain to wi exam se khatang thambiyu ne mayam.
Exam se haidi athawa mi khatana udi khangani ko.
Kayam lu ge je.
Mi na di negative marking leite khote na di yamna laiba di man ko pakhot ta phasalam so dum chung ga doi mong da.
Daw ye nga kai ga.
Ado di su aya ro si exam jai di tha yam drabada dum mari manga bukti dum consistent na ina dum pa ba di mathau di change ko. Aduga haidi dedication am di change haidi MCI se ahamba second attempt da pass tawgiba mi moi di yamna phaieba. Haidi adun khatang back hangiba se sida ne ba demotivate chat to se angang si jodum ade mo haidi khara kuina hangraga na mo hogot pangam dana dum mathanda dum madung do lesson gi se haidi ni ju samna da adu maya dum haidi demotivate oira dum lai bane ba ado ai su haidi coaching se kuire ba yauda ba aduga dum marks dum chi to dum wal hoba dum
khatang her wal hoba
adum wal hoba 141 phangba adum khara machi dum aina
adi 141 phangba ga se mark mapan khatani ne wali se question mapan khatani ba pass out de wali se as
aduana di chi to wat pa ado adum preparation jai di phasana ta hoda do adi adum exam naksal la tha ani muk tanga ngai ga na pa ba hoba gumba ado phasana yawba side handak si akhoi FMG gi sida yawba ne ba Manipur da ham ba hang do e na taw da
Manipur gi natan se di ain sum taja notice entire notice ki sida even Kolkata da baw leite hai si center se
Manipur akhoi pura notice ta si khatang ne branch hang se jin no ado si na budi am help taw re yum sun am sa ba thak pa da su ngai re da adum
Saning bachara like pa ba yare ba.
Library so dum PV ba da oina free da. Adum coaching yaw ba mi ga ye dum paning matam paw na. Adum ai dum coaching su yaw dum library da nga hamu adum ai tawraga. Budi khara budi khon.
The study room sida su dum yam chik lawai na sum manung do feel taw zaru ba da ko like pa pam se yam nungai ba hai tare. Ado sumaina akhoi mapan dagi oza ngatani sum tawri myam si. Mapan gi oza sing si quality se khoi topper even topper bhaw da yawe hai. FMG exam top taw gi ba oza am su hujik lei hai ma su tang unar wai sana jaga doine kamai tawi mafam se takpiri bo za sing khatang thambiyo
oza sing lak pasing se moi di experience ka tane do budi moi ai di yam draba da chahi minimum ha ru chahi ahum mari bakti tala bo za nga tane ba aduga especially Delhi da takpa center da gi direct tharak pane ba akhoi Manipur gi kaino su yaw bana te bo za teacher ai moi gi direct coaching faculty nga tane do budi adu moi gi hai di khutak si su dum ha di different system na system nine odi phatan tae ko je moi jo hai di schedule dung phajana khaido ga dudana du loisan ba khot pa de MCQ gi matam de grant test ka lor khini moi hai di test nung pi bo khot pa subject loi khama tung da ko adu mai na ga le kan ya de adu koi na class to ya hau dre jo moi tonga na online gi ꯀꯩꯅꯣꯝꯁꯨ ꯄꯤꯔꯤꯕ
Online class.
ꯑꯣꯟꯂꯥꯏꯟꯒꯤ ꯍꯥꯏꯗꯤ ꯑꯦꯞ ꯑꯃ ꯄꯤꯔꯤꯕ ꯑꯗꯨꯗ ꯑꯗꯨꯝ ꯃꯁꯥꯒꯤ ꯔꯦꯀꯣꯔꯗꯦꯗ ꯚꯤꯗꯤꯑꯣ ꯅꯨꯡ ꯀꯩꯀꯥ ꯂꯣꯏ ꯌꯥꯎꯔꯦ ꯑꯗꯨꯗ MCQ ꯅꯨꯡ ꯀꯩꯀꯥ ꯑꯩꯈꯣꯏ ꯍꯣꯠꯅꯤꯡꯕ ꯈꯣꯠꯄ ꯑꯗꯨꯒꯤ ꯍꯥꯏꯔꯕꯗꯤ ꯑꯗꯨꯅꯁꯨ ꯌꯥꯝꯕꯨꯗꯤ ꯀꯥꯟꯅꯕ ꯍꯥꯏꯇꯥꯔꯦ
ꯑꯗꯣ ꯉꯁꯥꯏ ꯕꯤꯐꯣꯔ ꯉꯁꯥꯏ ꯁꯤꯒꯤ ꯃꯐꯝꯁꯤꯗ ꯍꯥꯏꯇꯥꯔꯦꯀꯣ ꯑꯦꯗꯃꯤꯁꯟ ꯇꯧꯗ꯭ꯔꯤꯉꯩ ꯃꯃꯥꯡ ꯁꯤꯒꯤ ꯀꯣꯆꯤꯡ ꯀ꯭ꯂꯥꯁꯦꯁꯁꯤꯡ ꯌꯥꯎꯗ꯭ꯔꯤꯉꯩ ꯃꯃꯥꯡꯒꯤ ꯄ꯭ꯔꯤꯄꯦꯔꯦꯁꯟ ꯇꯥꯏꯞꯇꯨꯒ ꯃꯐꯝꯁꯤꯗ ꯂꯥꯛꯈ꯭ꯔꯕ ꯃꯇꯨꯡꯗ ꯄ꯭ꯔꯤꯄꯦꯔꯦꯁꯟ ꯇꯥꯏꯞꯁꯦ ꯀꯃꯥꯏ ꯈꯦꯠꯅꯔꯛꯏ ꯈꯤꯇꯪ ꯊꯝꯕꯤꯌꯣ ꯑꯗꯨꯁꯨ
ꯑꯗꯨꯗꯤ ꯌꯥꯝ ꯈꯦꯠꯅꯔꯦ ꯀꯣꯆꯤꯡ ꯌꯥꯎꯗꯅ ꯄꯥꯔꯛꯄꯒ ꯀꯣꯆꯤꯡ ꯌꯥꯎꯔꯒ ꯄꯥꯔꯛꯄꯁꯤꯒ ꯗꯤꯐ꯭ꯔꯦꯟꯁꯁꯦ ꯑꯗꯨꯗꯗꯤ ꯌꯥꯝ ꯊꯤꯅ ꯍ꯭ꯌꯨꯖ ꯗꯤꯐ꯭ꯔꯦꯟꯁ ꯑꯃ ꯂꯩꯔꯦ ꯍꯥꯏꯗꯤ ꯑꯩꯈꯣꯏꯅ ꯀꯣꯆꯤꯡ ꯌꯥꯎꯗꯅ ꯑꯩꯅ ꯄ꯭ꯔꯤꯄꯦꯔꯦꯁꯟ ꯇꯧꯋꯦ ꯍꯥꯏꯔꯁꯨ ꯅꯣꯡꯃꯗ ꯍꯥꯏꯗꯤ 10 ꯑꯋꯥꯔꯁꯦ ꯑꯗꯨꯝ ꯗꯥꯏꯔꯦꯛ ꯁ꯭ꯇ꯭ꯔꯦꯠꯇ ꯐꯝꯃꯒ ꯄꯥꯕꯁꯦ ꯗꯤꯁꯇ꯭ꯔꯦꯛꯁꯟ ꯌꯥꯝ ꯂꯥꯛꯑꯦꯕ ꯑꯗꯨꯀꯥꯟꯗ ꯍꯥꯏꯗꯤ ꯌꯨꯝꯗ ꯄꯥꯕ ꯑꯣꯏꯔꯣ ꯂꯥꯏꯕ꯭ꯔꯦꯔꯤꯗ ꯄꯥꯔꯁꯨ ꯋꯥꯕ ꯈꯣꯠꯄ ꯑꯇꯩ ꯑꯇꯩ ꯂꯩꯗꯅ ꯑꯗꯨꯃꯥꯏꯅ ꯃꯌꯥꯝ ꯂꯥꯛꯑꯦ ꯑꯗꯨ ꯑꯣꯏꯔꯁꯨ ꯍꯥꯏꯗꯤ ꯀꯣꯆꯤꯡꯁꯦ ꯌꯥꯎꯈ꯭ꯔꯒꯅ ꯑꯃꯨꯛ ꯂꯥꯏꯔꯤꯛꯁꯦ ꯅꯪ ꯑꯌꯨꯛ ꯉꯟꯇꯥ ꯀ꯭ꯂꯥꯁꯇꯣ ꯍꯧꯔꯒ ꯐꯝꯕꯗꯩꯅ ꯅꯨꯡꯗꯥꯡ ꯇꯥꯔꯒ ꯑꯗꯨꯝ ꯐꯝꯗꯣꯏꯅꯤ ꯍꯥꯏꯗꯤ ꯍꯧꯒꯠꯄ ꯆꯠꯄ ꯌꯥꯕ ꯅꯠꯇ꯭ꯔꯦ ꯆꯠꯆꯈ꯭ꯔꯒꯅ ꯏꯁꯥ ꯃꯥꯡꯖꯕꯅꯤꯀꯣ ꯑꯗꯨꯃꯥꯏꯅꯕꯨꯗꯤ ꯑꯗꯨꯃꯥꯏꯅ ꯍꯥꯏꯗꯤ ꯁꯤꯁꯇꯦꯝ ꯅꯥꯏꯔꯛꯄꯗꯨꯅꯕꯨꯗꯤ ꯍꯥꯏꯗꯤ ꯕꯨꯁꯇꯣ ꯑꯦꯛꯁꯇ꯭ꯔꯥ ꯄꯤꯌꯦꯕ
ꯑꯗꯣ ꯃꯄꯥꯟꯗ ꯐꯣꯔꯦꯟ ꯀꯟꯇ꯭ꯔꯤꯁꯇ ꯗꯣꯛꯇꯔ ꯇꯝꯃꯨꯕꯁꯤꯡꯁꯦ ꯗꯣꯛꯇꯔꯒꯤ ꯗꯤꯒ꯭ꯔꯤꯗꯨꯗꯤ ꯐꯪꯂꯛꯑꯕ ꯃꯇꯨꯡꯗ ꯏꯟꯗꯤꯌꯥꯗ ꯄꯥꯁ ꯇꯧꯒꯦ ꯍꯥꯏ ꯇꯥꯔꯗꯤ ꯈ꯭ꯋꯥꯏꯗꯒꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯕꯤగ్గꯦꯁ ꯍꯔꯗꯜ ꯑꯣꯐ ꯂꯥꯏꯐꯅꯦ ꯍꯥꯏꯅ ꯑꯩꯅ ꯁꯨꯝ ꯇꯥꯖꯩꯀꯣ ꯁꯤꯒꯤꯁꯦ ꯄꯥꯁ ꯇꯧꯅꯅꯕ ꯍꯣꯠꯅꯔꯛꯄ ꯃꯇꯝꯗ ꯁ꯭ꯇ꯭ꯔꯒꯜ ꯃꯌꯥꯝ ꯊꯦꯡꯅꯕꯤꯔꯝꯒꯅꯤ ꯍꯥꯏꯇꯥꯔꯦ ꯁ꯭ꯇ꯭ꯔꯒꯜ ꯃꯌꯥꯝ ꯊꯦꯡꯅꯔꯕ ꯃꯇꯨꯡꯗ ꯁꯨꯃꯥꯏꯅ ꯑꯦꯛꯖꯥꯝ ꯄꯥꯁ ꯇꯧꯔꯛꯑꯦ ꯍꯥꯏꯕꯒꯤ ꯄꯥꯎꯁꯦ ꯍꯦꯛ ꯇꯥꯕ ꯃꯇꯝꯗ ꯏꯁꯥꯗ ꯀꯔꯤ ꯐꯥꯎꯏ ꯈꯤꯇꯪ ꯊꯝꯕꯤꯌꯨ
ꯑꯍꯥꯟꯕꯗꯕꯨꯗꯤ MCIꯁꯤ ꯁꯦꯡꯅ ꯍꯥꯏꯔꯗꯤ ꯍꯥꯏꯗꯤ ꯀꯩꯅꯣ ꯑꯦꯛꯖꯥꯝ ꯈꯛꯇ ꯅꯠꯇꯦꯕ ꯃꯄꯥꯟ ꯇꯝꯃꯛꯄ ꯑꯩꯈꯣꯏꯒꯤꯗꯤ ꯌꯥꯝꯅ ꯕꯤగ్ ꯆꯦꯂꯦꯟꯖꯅꯦꯕ ꯁꯤ ꯄꯥꯁ ꯇꯧꯗ꯭ꯔꯤꯉꯩꯗꯤ ꯀꯩꯝ ꯅꯠꯇꯦ
ꯀꯩꯝ ꯇꯧ ꯌꯥꯗ꯭ꯔꯦ
ꯇꯨꯌꯦꯜꯞ ꯄꯥꯁꯅꯦꯕ ꯑꯣꯏꯗꯣꯏꯁꯦ ꯍꯥꯏꯗꯤ ꯑꯗꯣ ꯍꯥꯏꯗꯤ ꯑꯍꯥꯟꯕꯗꯕꯨꯗꯤ ꯊꯥꯔꯛꯄꯗꯕꯨꯗꯤ ꯌꯥꯝ ꯂꯨꯕ ꯃꯥꯜꯂꯝꯃꯦꯀꯣ ꯍꯣꯞꯇꯣ ꯍꯥꯏꯗꯤ ꯀꯌꯥ ꯂꯩꯔꯝꯗꯦ ꯑꯗꯣ ꯁꯨꯝ ꯑꯃꯨꯔꯛ ꯑꯅꯤꯔꯛ ꯊꯥꯔꯛꯑꯒ ꯁꯨꯝ ꯈꯪꯉꯛꯄ ꯍꯦꯜꯂꯛꯑꯀꯥꯟꯗ ꯑꯦꯛꯖꯥꯝ ꯄꯦꯇꯔꯟ ꯅꯨꯡ ꯌꯦꯡꯉꯀꯥꯟꯗ ꯁꯤꯗꯤ ꯏꯃꯥꯟꯅꯕꯁꯨ ꯄꯥꯁ ꯇꯧꯅꯕ ꯌꯥꯎꯅꯩ ꯑꯗ ꯁꯤꯗꯤ ꯑꯣꯏꯊꯣꯛꯄ ꯌꯥꯕ ꯄꯣꯠ ꯑꯃꯅꯤ ꯍꯥꯏꯕꯗꯤ ꯑꯗꯨꯝ ꯐꯤꯜꯗꯣ ꯂꯥꯛꯑꯀꯥꯟꯗꯅꯦꯕ ꯑꯗꯨꯝ ꯍꯣꯠꯅꯔꯛꯏꯁꯦ ꯃꯌꯥꯝ ꯂꯣꯏꯅꯃꯛ ꯑꯗꯣ ꯄꯥꯁ ꯇꯧꯕ ꯐꯥꯎꯕꯁꯦ ꯑꯩ ꯍꯟꯗꯛꯀꯤꯁꯤꯗꯤ ꯌꯥꯝ ꯉꯟꯅꯁꯨ ꯍꯥꯏꯗꯣꯔꯛꯑꯦ ꯊꯥꯖꯗꯦꯕ ꯑꯗꯨꯒ ꯏꯃꯥꯟꯅꯕ ꯑꯃ ꯐꯣꯟ ꯇꯧꯔꯛꯄꯅꯦ ꯑꯦꯛꯖꯥꯝ ꯔꯤꯖꯜ ꯌꯦꯡꯉꯕꯅ ꯑꯗꯣ ꯑꯩꯗꯣ ꯍꯞꯇꯥꯗꯪ ꯐꯥꯗ ꯉꯥꯏꯔꯦ ꯑꯩꯅ ꯈꯜꯂꯤꯁꯤꯅ ꯐꯥꯒꯤ ꯇꯧꯅꯩꯅꯦꯅ ꯈꯟꯕ ꯑꯗꯩ ꯉꯥꯏꯍꯥꯛ ꯂꯩꯔ ꯒ꯭ꯔꯨꯞꯇ ꯂꯥꯛꯅꯔꯦ ꯃꯦꯁꯦꯖ ꯑꯩ ꯀꯤꯕꯨꯗꯤ ꯀꯤꯖꯩ ꯂꯥꯛꯑꯝꯗꯣꯏꯅ ꯈꯣꯠꯇꯣꯏꯅ ꯈꯟꯖꯥꯟꯅꯕ ꯑꯃ ꯌꯥꯎꯔꯦ ꯑꯦꯛꯖꯥꯝꯕꯨꯗꯤ ꯑꯗꯨꯝ ꯅꯨꯡꯉꯥꯏꯈ꯭ꯔꯦ ꯑꯗꯩ ꯌꯦꯡꯉ ꯄꯥꯁ ꯇꯧꯔꯦ ꯍꯥꯏꯕꯗꯗꯤ ꯈꯪꯗꯦ ꯑꯗꯨꯏ ꯍꯔꯥꯎꯕꯗꯨꯗꯤ ꯗꯤꯁꯀ꯭ꯔꯥꯏꯕ ꯇꯧꯕ ꯉꯝꯗꯦ
ꯁꯤꯒꯤ ꯅꯨꯡꯉꯥꯏꯕꯒꯤ ꯃꯤꯀꯨꯞꯁꯤꯅꯦꯕ ꯃꯌꯥꯝꯅ ꯉꯥꯏꯅꯔꯤꯁꯦ ꯀꯣꯆꯤꯡꯒ ꯇꯧꯗꯅ ꯊꯥ 4-5 ꯀꯣꯆꯤꯡꯒ ꯐꯝꯗꯅ ꯇꯧꯅꯔꯤꯁꯤ ꯅꯠꯇ꯭ꯔꯥ ꯑꯗꯣ ꯑꯩꯅ ꯕ꯭ꯔꯗꯔꯗ ꯍꯪꯖꯅꯤꯡꯕ ꯑꯃ ꯂꯩ ꯃꯅꯤꯄꯨꯔꯗ ꯁꯤꯒꯤ ꯑꯦꯛꯖꯥꯝꯁꯦ FMGE ꯑꯦꯛꯖꯥꯝꯁꯦ ꯊꯥꯕꯁꯤ ꯍꯟꯖꯟ ꯊꯥꯕ ꯃꯇꯝꯗ ꯀꯥꯎꯟꯠꯂꯦꯁ ꯅꯝꯕꯔ ꯑꯣꯐ ꯑꯦꯛꯖꯥꯝ ꯊꯥꯕ ꯌꯥꯏ ꯍꯥꯏꯅ ꯑꯩꯅ ꯇꯥꯖꯩꯀꯣ ꯀꯦꯔꯤꯌꯔꯁꯦ ꯑꯩ ꯉꯔꯥꯡꯗꯁꯨ ꯚꯤꯗꯤꯑꯣ ꯑꯃ ꯊꯦꯡꯅꯖꯩ ꯃꯥꯁꯦ 28 ꯑꯦꯇꯦꯝꯞ ꯍꯥꯏꯇꯥꯔꯦꯀꯣ ꯑꯥꯐꯇꯔ 14 years ꯃꯥꯁꯦ FMGE ꯑꯦꯛꯖꯥꯝꯁꯦ ꯄꯥꯁ ꯇꯧꯋꯦꯅ ꯍꯥꯏꯗꯤ ꯆꯍꯤ ꯑꯃꯗ ꯑꯅꯤꯔꯛ ꯇ꯭ꯔꯥꯏ ꯇꯧꯕꯁꯦ 28 ꯂꯛ ꯇ꯭ꯔꯥꯏ ꯇꯧꯕ ꯃꯇꯝꯗ ꯃꯥꯁꯦ ꯄꯥꯁ ꯇꯧꯋꯦ ꯃꯁꯥ ꯀꯩꯁꯨ ꯏꯀꯥꯏꯗꯕꯤꯗ ꯌꯨꯇ꯭ꯌꯨꯕꯇ ꯕ꯭ꯂꯣꯒ ꯑꯃ ꯁꯦꯝꯃꯒ ꯃꯣꯇꯤꯚꯦꯁꯅꯦꯜ ꯚꯤꯗꯤꯑꯣ ꯇꯥꯏꯞ ꯑꯃ ꯊꯥꯗꯣꯔꯛꯏ ꯃꯌꯥꯝ ꯀꯩꯁꯨ ꯏꯀꯥꯏꯅꯤꯡꯉꯥꯏ ꯂꯩꯇꯦ ꯍꯥꯏꯕꯁꯤꯅꯦ ꯑꯗꯣ ꯃꯅꯤꯄꯨꯔꯗꯗꯤ ꯑꯩꯈꯣꯏ FMGE ꯑꯦꯛꯖꯥꯝ ꯊꯥꯕꯁꯦ ꯄꯥꯁ ꯇꯧꯗꯦ ꯍꯥꯏꯔꯒꯁꯨ ꯄꯪꯏꯗ ꯏꯀꯥꯏꯕ ꯏꯚꯟꯁꯦ ꯀꯣꯆꯤꯡ ꯁꯦꯟꯇꯔ ꯇꯧꯕꯗ ꯃꯐꯝꯁꯦ ꯊꯦꯡꯅꯕ ꯄꯪꯏꯗ ꯏꯀꯥꯏꯕ ꯁꯤꯁꯇꯦꯝ ꯑꯃ ꯂꯩ ꯍꯥꯏꯇꯥꯔꯦ ꯁꯤꯒꯤꯁꯦ ꯀꯔꯤꯗꯕꯨ ꯏꯀꯥꯏꯅꯤꯡꯉꯥꯏ ꯂꯩꯒꯦ ꯃꯤꯒꯤ ꯃꯄꯣꯠ ꯃꯔꯜ ꯍꯨꯔꯥꯟꯕꯗꯕꯨ ꯑꯩꯈꯣꯏ ꯏꯀꯥꯏꯕꯩ ꯋꯥꯅꯤ ꯅꯠꯇ꯭ꯔꯅꯦ ꯂꯥꯏꯔꯤꯛ ꯇꯝꯂꯀꯥꯟꯗ ꯁꯨꯃꯥꯏꯅ ꯑꯦꯛꯖꯥꯝ ꯑꯃ ꯍꯥꯏꯗꯤ ꯉꯁꯥꯏꯒꯤ ꯂꯥꯏꯕꯛꯅ ꯇꯝꯗꯗꯅ ꯑꯗꯨꯒ ꯄꯥꯔꯨꯕꯁꯤꯡꯗꯨꯒ ꯆꯥꯟꯅꯗꯕ ꯑꯗꯨꯒ ꯁꯝꯇꯥꯏꯝꯁ ꯈꯤꯇꯪ ꯋꯤꯛ ꯑꯣꯏꯕ ꯁꯕꯖꯦꯛ ꯌꯥꯎꯈꯤꯕꯗꯒꯤ ꯕ꯭ꯔꯗꯔꯁꯨ ꯉꯁꯥꯏ ꯍꯥꯏꯗꯨꯅꯦ 100ꯀ 46 44 fꯪꯕ 41 ꯐꯪꯕ ꯆꯤ ꯂꯥꯎꯕ ꯃꯌꯥꯝ ꯌꯥꯎꯔꯝꯒꯗꯣꯏꯅꯦꯕ ꯁꯤꯗ ꯀꯩꯝꯇ ꯏꯀꯥꯏꯅꯤꯡꯉꯥꯏ ꯑꯣꯏꯗꯦ ꯍꯥꯏꯕꯅꯤꯀꯣ ꯑꯩꯅ ꯁꯨꯝ ꯐꯤꯜ ꯇꯧꯖꯕ ꯏꯁꯥꯒꯤ ꯃꯥꯏꯀꯩꯗꯒꯤ ꯀꯩ ꯊꯝꯕꯤꯅꯤꯡꯉꯦ ꯍꯥꯏꯗꯤ ꯍꯟꯖꯟ ꯑꯦꯛꯖꯥꯝ ꯊꯥꯔꯒ ꯄꯥꯁ ꯇꯧꯗ꯭ꯔꯦ ꯍꯥꯏꯔꯒꯁꯨ ꯋꯥꯟ ꯗꯦ ꯉꯁꯥꯏꯒꯤ 28 ꯁꯨꯕ ꯑꯦꯛꯖꯥꯝꯗ ꯄꯥꯁ ꯇꯧꯕꯁꯨ ꯃꯣꯇꯤꯚꯦꯁꯟ ꯑꯣꯏꯔꯤꯅꯦꯕ ꯁꯤ ꯃꯇꯥꯡꯁꯤ ꯈꯤꯇꯪ ꯊꯝꯕꯤꯔꯝꯃꯣ
ꯑꯩ ꯍꯥꯏꯖꯅꯤꯡꯕꯁꯤꯗ ꯍꯥꯏꯗꯤ ꯑꯩꯅ ꯆꯪꯉꯨꯕ ꯂꯝꯕꯤꯗꯣ ꯑꯗꯨꯗ ꯍꯥꯏꯗꯤ ꯏꯁꯥꯅ ꯀꯩꯅꯣ ꯏꯀꯥꯏꯕ ꯈꯣꯠꯄꯗ ꯌꯦꯡ ꯂꯩꯔꯒ ꯍꯥꯏꯗꯤ ꯁꯝꯅ ꯍꯥꯏꯔꯕꯗ ꯑꯩꯅꯕꯨ ꯀ꯭ꯂꯥꯁ ꯇꯝꯃꯦ ꯍꯥꯏꯗꯣ ꯁꯤꯗ ꯍꯟꯗꯛ ꯑꯍꯥꯟꯕ ꯍꯥꯡꯕꯁꯤꯁꯨ ꯑꯩꯒꯤ ꯖꯨꯅꯤꯌꯔ ꯌꯥꯝ ꯌꯥꯎꯋꯦꯕꯀꯣ ꯑꯩꯈꯣꯏ ꯁ꯭ꯀꯨꯜꯃꯛꯇꯩꯁꯨ ꯌꯥꯎꯏ ꯑꯗꯨ ꯅꯠꯇꯕ ꯑꯇꯣꯞꯄꯗꯩ ꯑꯩꯒ ꯈꯪꯅꯕ ꯖꯨꯅꯤꯌꯔ ꯍꯥꯏꯁꯦ ꯑꯩꯅ ꯑꯗꯨꯝ ꯍꯟꯕ ꯆꯍꯤ 3 ꯍꯟꯕꯁꯨ ꯌꯥꯎꯏꯀꯣ ꯑꯗꯨꯗꯒꯤ ꯍꯥꯏꯗꯤ ꯑꯗꯨꯝ ꯂꯣꯏꯅ ꯑꯝꯍꯥꯅꯦꯕ ꯑꯗꯨ ꯂꯣꯏꯅ ꯆꯞ ꯃꯥꯟꯅꯔꯛꯀꯅꯤ
ꯀ꯭ꯂꯥꯁ ꯑꯃꯗꯗꯤ ꯂꯣꯏ ꯆꯞ ꯃꯥꯟꯅꯔꯦ
ꯍꯣꯏ ꯀ꯭ꯂꯥꯁ ꯃꯅꯨꯡꯗ ꯇꯝꯃꯤꯟꯅꯔꯛꯄꯗꯩ ꯅꯪ ꯅꯣꯏ ꯐ꯭ꯔꯦꯟ ꯉꯥꯛꯇ ꯑꯣꯏꯔꯛ ꯇꯥꯕꯅꯤ ꯅꯪꯅ ꯖꯨꯅꯤꯌꯔ ꯑꯗꯨ ꯂꯩꯇꯦ ꯑꯗꯣ ꯃꯌꯥꯝ ꯃꯣꯏꯁꯨ ꯇꯝꯃꯤ ꯑꯩꯈꯣꯏꯁꯨ ꯇꯝꯅꯩ ꯃꯌꯥꯝꯗꯣ ꯑꯗꯨꯝ ꯏꯁꯥꯒꯤ ꯂꯥꯏꯟꯗꯨꯗ ꯃꯥꯏ ꯄꯥꯛꯅꯕꯒꯤꯗꯃꯛꯇꯅꯤꯗꯅ ꯆꯪꯉꯤꯗ ꯑꯗꯨꯗ ꯏꯀꯥꯏꯅꯤꯡꯉꯥꯏ ꯀꯩꯝ ꯂꯩꯇꯦ ꯍꯥꯏꯗꯤ ꯄꯥꯁ ꯇꯧꯕꯁꯤꯅ
ꯃꯔꯨꯅꯤ
ꯍꯣꯏ ꯃꯣꯁ ꯃꯦꯇꯔ ꯑꯣꯏꯅꯦꯕ ꯑꯗꯨꯅꯗꯤ ꯅꯪ ꯁꯤ ꯑꯃꯨꯛꯇꯪ ꯍꯥꯏꯗꯤ ꯄꯥꯁ ꯇꯧꯗ꯭ꯔꯤ ꯍꯥꯏꯕ ꯅꯪ ꯑꯦꯛꯖꯤꯁ ꯇꯧꯕ ꯅꯠꯇꯦꯕ ꯃꯤꯅꯁꯨ ꯍꯪꯕꯗꯁꯨ ꯊꯣꯛꯅꯤꯡꯕ
ꯍꯥꯏꯗꯤ ꯑꯦꯛꯖꯥꯝꯗꯣ ꯄꯥꯁ ꯇꯧꯔꯕ꯭ꯔꯥ ꯍꯪꯉꯛꯀꯗꯣꯏꯅꯤꯀꯣ ꯂꯩꯀꯥꯏꯗꯐꯥꯎꯗ ꯑꯗꯨꯝ ꯍꯪꯅꯕꯅꯦ ꯍꯥꯏꯗꯤ ꯅꯣꯏ ꯅꯆꯥꯅꯨꯄꯥꯗꯣ ꯃꯄꯥꯟꯗ ꯁꯦꯜ ꯌꯥꯝ ꯆꯪꯈꯩ ꯇꯝꯃꯨꯕꯗꯣ ꯀꯃꯥꯏꯅ ꯇꯧꯔꯦ ꯀꯥꯏ ꯍꯪꯕꯗ ꯍꯦꯛꯇ ꯍꯥꯏꯗꯤ ꯂꯩꯀꯥꯏꯒꯤ ꯃꯌꯥꯝꯁꯨ ꯃꯤꯅꯣꯛ ꯃꯩꯁꯥꯁꯦ ꯅꯣꯛꯅꯗꯣꯏ ꯉꯥꯏ ꯂꯩꯅꯦ ꯑꯗꯣ ꯆꯠꯅꯕꯤꯁꯤꯁꯨ ꯍꯣꯡꯗꯣꯛꯄ ꯐꯩ ꯍꯥꯏꯅ ꯈꯜꯂꯦ ꯍꯥꯏꯗꯤ ꯍꯣꯠꯅꯔꯤꯕ꯭ꯔꯥ ꯀꯃꯥꯏꯅ ꯇꯧꯏ ꯍꯥꯏꯅ ꯍꯪꯕꯤꯕꯒꯤ ꯃꯍꯨꯠꯇ ꯄꯥꯁ ꯇꯧꯕ ꯉꯝꯖꯔꯕ꯭ꯔꯥꯅꯦ ꯀꯥꯏ ꯋꯥꯍꯪꯁꯤꯁꯨ ꯍꯪꯕꯤꯗꯕ ꯅꯠꯇ꯭ꯔꯅꯦ
ꯑꯗꯣ ꯑꯩꯅ ꯍꯥꯏꯖꯅꯤꯡꯉꯤ ꯄꯦꯔꯦꯟꯁꯁꯤꯡꯁꯦ मोइदा याम ह्यूज रोल अमबुदि लैको हाइदि सपोर्ट तौबिबसे हाइदि मोइना खल्लिसे हाइदि सुम लाइक पादबमक सुना असिदा थानाइब एग्जाम थाइसे एटलीस्ट 130 हेलकपसिंगसे लाइक पादब अमता नत्तेबसे लाइक लोइ पाना थाइ गाता
माने 130 योग पाइसे दम
130 योग पाइसे दम बदाउगुम्बा खरा नत्रगना माइ कॉन्सेप्ट नु क्लियर ओइ हौदबा आइसु हाइदि हाम था फर्स्ट टाइम FMG था अदुदबुदि डायरेक्ट 138 फंगे हाम फर्स्ट टाइम ता अदुदि खर नुंगाय अदे वाखल सं लाइथोखिबा अदुदे 138 जो अदि मथंददि
मथंद लाइन थोमनिदा
यानी खन्ननिबा अदुमदि सुंगा यारोय हाइदि 138 फंगेरा 149 फंगेरा को चप माने
149 फंगसु नुंसिबिदना मा आं खतने पिरके हाइबे वाफम लैतेबा सिदा नो मर्सी
अदुना हाइदि बेस्ट ति सागी फुल बेस्ट अमतंग पिबा अदुगा अदुदा लाहौद्रगना मु अदुम कइनोदो हाइदि मोटिवेट तो अदुम मोटिवेट तो थम्बदि सादा
होय होय
हाइदि हेता डिमोटिवेट चखरगा हाइदि लाइ पाबे महत अदुम फमुंग सोशल लाइनिंग टाइमिंग यावबनेबा केम तौनिंगदबा अदुगुम्बदो खरा स्ट्रगल तौवा ताय
याम नुंगाय ब्रदर सुमाइना कोगी कइबा किर्गिस्तान दा तमागा कोई इंडिया की हुजिकी मयाम MCI एग्जाम हाइनबा दुगा FMGE हाइतारे मयाम फॉरेन मेडिकल ग्रेजुएट एग्जामिनेशन रिसेंटली पास तौबनी ब्रदर सिसु टाइमिंग चादना कोई मफम से थेनजबदगी मयाम दा महाकना थेनर कोई स्ट्रगल सिंग हाइपेट शेयर तौबियोन हाइजरोबदा शेयर तौबिरमबगी थागत फोंदोचरी कांग्रेचुलेशन वंस अगेन ओके अदो आई मथंग दा लाक्सगे ओजा स्टूडेंट सिंग से हाइजबदो ब्रदर सेनबुदि हाइबदि हाइरे कोई क्लासरूम अमदा तमिनगदोइसे मागे सेम चही मानब ngato oiroi चही ahum hangiba yai manga hangiba tara hangiba kun even 20 years hen babo thengnak pa yai sida demotivate oibagi mathau su ta de
ta de tasina akoi de struggle to just 4-5 months khatang struggle to ram matung
course sama da 4-5 months
4-5 months tang kana hona matung da next exam he haidok pa de exam thara haidok de doctor haiba mingthon du phangadur ne adu regadi akoi ni ikai pham suk thok te masi yum na tum laigadi sabudi sugumba class yaubi raga mai pakna hona ban hena phaganen khanje
ado yam bodi nungai do system se kamai to ye sai exam se pass to redana 150 se cross to matung da pass to lau thro ka to ni ko mathang step se kamai
mathang step si kana gumba intern to raga lakpa satra oiragadi sida makha tan intern to da su yai kai gumba intern to da bida lak oiragadi sigi akhogi medical director ta form thajal matung da location wise moin pirakani Jennings da Rims da Sija da Churachangpur da different location da pirakani mana phagiba mark tu matungena aduga intern tawba yabai ayaba ma piri government
ado oza mafam sida mapan dagi oza mayam su la atak pi hai experience there mayam even topper FMCG gi topper na su adum mafam se la atak pi hai tare kari subject sing no tak pi do
subject trampan tak pi huji koi subject se pulap subject sida la atak pi se
hai exam sida koi subject 19 subject
19 subject mo si loina offline attack kani sida ado akoi 19 subject si oja si 19 oja la kani oja si Delhi de ki lakun haktani ado
adi swai local
teacher local oja te India gi coaching institute mo gi location manga tok ta lai manga tok ta tai bo oja si same oja tu Manipur su la ga ta pi
okay es samwai ba
ado 19 subject si loi cover to do ne ado si akoi si second base ni Manipur ta se already first base ta ukre hujik nakki mamang da anga am interview pi du so ai gi sida coaching yaw ki bangang mangni pass to bangang
first batch hoiga do
first base ni daniman pass to se akoi gi first base Manipur da how first base ki student ne abo hauji class to se second base already
ta first batch se student kaya mo exam se pass to
akoi si regular course ta angang pratuk ta te khaktang tau ki angang pratuk ta te da angang ma pan yaw ki
percentage
yang wangi adagi akoi QRS na ma tawi QRS ta de angang 40 muk lai angang 40 muk sida angang tra te train ban pass tawi
okay ado kai subject no dom tak have you know
akoi subject si ENT ta kani forensic medicine pediatric physiology dermatology PSM psychiatry ophthalmic pharmacology biochem OBG surgery anatomy pathology radiology anesthesia medicine microbiology ophthalmology hai ba subject trampasi loima cover to gani
hai ado jam mam la ga to
wa jam la to du ne
ado ngasi ekhoina class lobby ri bo ja se Dr. Omkar Sanawani se lai hai ko
huju surgery mana ta pi ri huju se
like se sigi like se ro dum
si wa ta si
bo do ne
mana se bo do ne coaching institution se bo do ne ado huju ma sa la ga class lori ado surgery huju mana tai
ꯃꯥꯁꯦ ꯑꯗꯨꯝ
ꯏꯟꯗꯤꯌꯥꯒꯤ
FMGE
ꯑꯐꯥꯎꯕ
ꯇꯣꯄꯔꯅꯤ
ꯑꯣꯖꯥꯅꯦ ꯑꯗꯣ ꯃꯥꯁꯤ ꯃꯥꯅ FMG ꯊꯥꯕ ꯃꯇꯝꯗ ꯏꯟꯗꯤꯌꯥꯒꯤ ꯇꯣꯄꯔ ꯑꯣꯏꯈꯤꯕ ꯁ꯭ꯇꯨꯗꯦꯟ ꯑꯃꯅꯤ
ꯑꯁ ꯌꯥꯝ ꯐꯩꯌꯦ ꯇꯣꯄꯔ ꯑꯃꯅ ꯁꯨꯃꯥꯏꯅ ꯂꯥꯏꯔꯤꯛ ꯇꯥꯛꯄꯤꯔꯝꯕꯁꯦ ꯌꯥꯝ ꯅꯨꯡꯉꯥꯏ ꯍꯥꯏꯇꯥꯔꯦꯅꯦ ꯍꯥꯏꯐꯦꯠ ꯁꯨꯝ ꯃꯥꯏ ꯃꯅꯥꯛꯇ
ꯌꯥꯏ,
ꯆꯪꯃꯤꯟꯅꯔ
ꯌꯥꯏ.
ꯁꯤ ꯀ꯭ꯂꯥꯁ ꯁꯤꯁꯦ ꯀ꯭ꯂꯥꯁ ꯔꯨꯝꯗ ꯑꯗꯨꯝ ꯂꯩꯔꯒ ꯂꯥꯏꯔꯤꯛꯁꯦ
ꯂꯩ ꯂꯩ ꯑꯩ ꯑꯗꯨꯝ ꯄꯥꯏꯖꯔꯛꯀꯦ
ꯃꯃꯥꯡ ꯊꯥꯕꯤꯔꯣ ꯑꯣꯖꯥ ꯌꯦꯡꯅꯕꯁꯦ
ꯅꯪꯁꯤ ꯑꯣꯝ ꯀꯥꯟꯗ ꯄꯤꯗꯣꯏ ꯂꯥꯛꯑꯣ
ꯌꯥꯝ ꯉꯁꯤꯒꯤ ꯄ꯭ꯔꯣꯒ꯭ꯔꯥꯝꯁꯦ ꯌꯥꯝ ꯏꯟꯇꯔꯦꯁꯇꯤꯡ ꯑꯣꯏꯀꯣ ꯂꯥꯏꯔꯤꯛꯀꯤ ꯑꯣꯏꯕꯅꯤꯅ ꯃꯌꯥꯝ ꯈꯤꯇꯪ ꯍꯥꯏꯗꯤ ꯃꯌꯥꯝꯅ ꯁꯤꯌꯔ ꯇꯧꯕ ꯈꯤꯇꯪ ꯋꯥꯠꯄ ꯃꯥꯜꯂꯤ ꯁꯤꯌꯔ ꯇꯧꯕꯤꯕ ꯏꯆꯤꯜ ꯏꯅꯥꯎꯁꯤꯡꯒꯤꯗꯃꯛꯇꯁꯨ ꯃꯌꯥꯝ ꯑꯩꯈꯣꯏꯅ ꯑꯈꯟꯅꯕꯒꯤ ꯋꯦ ꯂꯩ ꯍꯥꯏꯅ ꯑꯩꯈꯣꯏꯅꯁꯨ ꯑꯦꯅꯥꯎꯟꯁ ꯇꯧꯖꯈꯤꯕꯅꯤꯀꯣ ꯁꯤꯗꯁꯨ ꯂꯥꯏꯕ꯭ꯔꯦꯔꯤ ꯂꯩ ꯑꯗꯨꯒ ꯀꯥꯈꯤꯗꯣꯏꯔꯣ ꯁꯤꯗꯒꯤ
ꯀꯥꯗꯕꯅꯦ ꯁꯤ ꯀ꯭ꯂꯥꯁꯔꯨꯝ
ꯃꯌꯥꯝ ꯁꯤꯌꯔ ꯇꯧꯕꯤꯔꯝꯕꯁꯤꯡꯒꯤ ꯋꯦ ꯂꯩ ꯑꯩꯅ ꯍꯥꯏꯖꯕꯅꯤ ꯔꯤꯀ꯭ꯋꯦꯁ ꯇꯧꯖꯔꯤ ꯃꯌꯥꯝ ꯁꯤꯒꯨꯝꯕ ꯄ꯭ꯔꯣꯒ꯭ꯔꯥꯝꯁꯦ ꯈꯔ ꯁꯤꯌꯔ ꯇꯧꯕꯤꯔꯝꯃꯣ ꯍꯥꯏꯗꯤ ꯃꯄꯥꯟꯗ ꯇꯝꯖꯔꯨꯕ ꯁ꯭ꯇꯨꯗꯦꯟꯁ ꯀꯌꯥ ꯑꯃ ꯑꯦꯛꯖꯥꯝꯁꯤ ꯄꯥꯁ ꯇꯧꯅꯅ ꯍꯣꯠꯅꯕ ꯃꯇꯝꯗ ꯑꯈꯟꯅꯕ ꯒꯥꯏꯗꯦꯟꯁ ꯑꯃ ꯂꯧꯅꯕꯒꯤꯗꯃꯛꯇ ꯃꯅꯤꯄꯨꯔꯒꯤ ꯃꯄꯥꯟꯗ ꯆꯠꯅꯕꯁꯤꯡꯗꯣ ꯆꯠꯇ꯭ꯔꯒꯁꯨ ꯌꯥꯔꯦ ꯏꯅꯛ ꯅꯛꯅ ꯏꯝꯐꯥꯜꯁꯤꯗ ꯂꯩꯔꯦ ꯍꯥꯏꯕꯒꯤ ꯅꯨꯡꯉꯥꯏꯕ ꯄꯥꯎꯁꯤꯅꯤꯀꯣ ꯑꯣꯖꯥ ꯃꯄꯥꯟꯗꯒꯤꯁꯨ ꯑꯗꯨꯝ ꯂꯥꯛꯑꯦ ꯍꯥꯏꯇꯥꯔꯦ
ꯂꯥꯛꯑꯦ ꯂꯥꯛꯑꯦ ꯍꯧꯖꯤꯛ ꯍꯧꯖꯤꯛꯁꯤ ꯑꯩꯈꯣꯏ ꯇ꯭ꯔꯤꯄꯨꯔꯥꯗꯩ ꯁꯥꯇ꯭ꯔ ꯌꯥꯎꯔꯤ ꯑꯁꯥꯝꯗꯩꯁꯨ ꯁꯥꯇ꯭ꯔ ꯌꯥꯎꯔꯤ
ꯑꯁ ꯑꯗꯨꯅꯦ ꯌꯥꯝ ꯅꯨꯡꯉꯥꯏꯌꯦ ꯃꯄꯥꯟꯗꯩꯁꯨ ꯂꯥꯛꯑꯦ ꯍꯥꯏꯁꯦ ꯍꯥꯏꯗꯤ ꯅꯣꯔꯠ ꯏꯁꯇ ꯂꯩꯇꯕꯅ ꯃꯔꯝ ꯑꯣꯏꯔꯒ ꯁꯤꯗ ꯂꯥꯛꯏꯅꯦꯕ ꯖꯣꯏꯟ
ꯃꯥꯅꯦ,
ꯇꯧꯕ
ꯃꯥꯅꯦ. ꯍꯧꯖꯤꯛ ꯍꯧꯖꯤꯛꯁꯤ ꯀ꯭ꯂꯥꯁ ꯇꯧꯔꯤ ꯑꯗꯨ ꯆꯪꯉꯒ ꯑꯗꯨꯝ ꯀꯩꯗꯧꯁꯤ ꯌꯥꯅꯤ
ꯑꯣꯀꯦ ꯀ꯭ꯂꯥꯁꯔꯨꯝꯁꯤꯗ ꯂꯩꯔꯦ ꯀ꯭ꯂꯥꯁꯔꯨꯝ ꯁꯤꯌꯔ ꯇꯧꯔꯦ ꯍꯥꯏꯅ ꯍꯥꯏꯕꯤꯔꯣ ꯊꯦꯡꯛ ꯌꯨ
ꯌꯥꯏ ꯆꯪꯕꯤꯕ ꯌꯥꯏ ꯆꯪꯁꯤ
Nothing else but a breast surgery or a thyroid surgery. When it is a
ꯌꯥꯝ
moderate
ꯅꯨꯡꯉꯥꯏꯕ ꯀ꯭ꯂꯥꯁꯁꯦ
surgery like a breast or a thyroid surgery, then we are going to multiply this amount of blood loss by 1.5. As you multiply this X grams of blood loss by 1.5, you will get the amount of blood loss in ml or cc beta for a moderate duration surgery. And lastly, if it is going to be a major surgery, which is when I talk about a major surgery means surgeries like a surgery done for pancreatic cancer. We'll discuss that, known as Whipple's procedure. Now, when it is a Whipple's procedure, it is minimum of 4 to 5 hours of surgery. Now, in these kind of surgeries, whatever amount we have calculated,
all over India topper ko si oigi si taise topper oigi
multiply it by 2 to get the
arai bo
amount
janate
of ml. Hopefully, that's clear to all of you. So, for routine surgery, you do not
ꯈ꯭ꯋꯥꯏꯗꯒꯤ ꯂꯨꯕ ꯃꯦꯗꯤꯀꯦꯜꯒꯤ ꯑꯦꯛꯖꯥꯝꯅꯦ ꯍꯥꯏꯅꯕ ꯃꯌꯥꯝ ꯑꯗꯨꯒꯤ ꯀ꯭ꯂꯥꯁꯅꯤꯀꯣ ꯍꯧꯖꯤꯛ ꯂꯧꯔꯤꯁꯦ ꯍꯥꯏꯗꯤ ꯀꯣꯆꯤꯡ ꯍꯥꯏꯇꯥꯔꯦ ꯃꯅꯤꯄꯨꯔꯒꯤ ꯃꯄꯥꯟꯗꯒꯤ ꯂꯥꯛꯄ ꯑꯣꯖꯥꯅ
And the last point which is there definitely in measuring the blood loss happened during surgery is, now we know during the surgeries what are we going to use? During the surgeries to soak the blood, we are going to use the mops. Okay? Second important thing, at the end of the surgery we'll get some kind of clots also. Okay? And third and the most important thing, nowadays we have also started using suction catheters, right? So when the surgery is going on, obviously there will be a blood loss at the surgical site, and definitely we are going to use a suction catheter to suck out all the blood from the surgical site. And when all this blood is sucked out from the surgical site,
doctor ꯑꯣꯏꯔꯛꯀꯗꯕ ꯃꯌꯥꯝꯗꯨꯒꯤ ꯃꯌꯥꯝ ꯂꯥꯏꯕꯛꯁꯦ ꯁꯤ ꯀ꯭ꯂꯥꯁꯔꯨꯝꯁꯤꯗ ꯑꯣꯏꯅ
now what are we going to do?
ꯆꯠꯈꯤꯗꯣꯏꯅꯦ ꯀꯟꯅ ꯍꯣꯠꯅꯔꯒꯗꯤ ꯑꯗꯨꯝ ꯃꯥꯏ ꯄꯥꯛꯑꯦ
Amount of blood loss that is happening during
ꯑꯣꯖꯥꯗꯤ
surgery,
ꯃꯇꯤꯛ ꯆꯥꯕ ꯑꯣꯖꯥ ꯉꯥꯛꯇꯅꯤꯀꯣ
we are going to add the amount of blood
ꯍꯣꯠꯅꯒꯗꯕ
loss
ꯁ꯭ꯇꯨꯗꯦꯟꯅ
that we have
ꯍꯣꯠꯅꯒꯗꯕ
estimated from the mops. Second, we are going to add the amount of blood loss that we have estimated from the clots. And third, we are going to add the amount of blood loss that we have estimated from the suction drain also. Now please tell me, if at the end of the surgery, there has been 2 liters of fluid in the suction drain. At the end of the surgery, if there has
Operation
been 2 liters of
matungda
fluid in the suction drain, can
operation
we consider
matungda
2 liters of blood loss?
이 ꯌꯥꯝ ꯆꯠꯈꯤꯕꯗꯣ ꯑꯗꯨꯒꯤ ꯃꯇꯥꯡꯅꯤ ꯋꯥꯔꯤ ꯁꯥꯟꯅꯔꯤꯁꯦ
Very good. Because we
ꯌꯥꯝ
might
ꯅꯨꯡꯉꯥꯏꯕ
have
ꯇꯣꯄꯤꯛꯅꯤꯀꯣ
also used
ꯑꯩꯈꯣꯏꯗꯤ
a
ꯀꯩꯝ
lot of
ꯈꯪꯗ꯭ꯔꯤ
irrigating fluid during the surgery.
ꯃꯦꯗꯤꯀꯦꯜ ꯁ꯭ꯇꯨꯗꯦꯟ ꯅꯠꯇꯕꯅꯤꯅ ꯈꯪꯗ꯭ꯔꯦ
And if we have used a lot of irrigating fluid during the surgery, that irrigating fluid would have also been collected inside the same suction drain itself. Now, for example, let's say there has been 2 liters of fluid collected inside the suction drain at the end of the surgery. And then at the end of the surgery, you ask your nurse definitely, or you ask your assistant how much amount of fluid has been used. Please remember, you always keep a track of the amount of irrigating fluid that you are going to use during the surgery. And she says definitely, Dr. Saab, we have used 2 bags of saline. That is nothing else but 1 liter of saline we have used. Now, there was 2 liters of fluid collected in the suction drain, and she is saying there is 1 liter of irrigating fluid used. So how much is the approximate blood loss? 1 liter. Okay? So the approximate blood loss at the end of the surgery will be 1 liter. So please remember, for major duration surgery, definitely the best approach that we have.
Okay.
Okay.
Mic up the mic. Let me have some couple of minutes, okay? Sir, sure. Nice to meet you. Sir, your good name?
Dr. Omkar.
Like Tomta. Okay, ma'am. I na ngasay haizabado like say surgery ki sige like say sir Omkar Sonawane. Sir, you are from which state of India?
I'm from Maharashtra.
Maharashtra. Nice to meet you. Students sing su like ko. Kamay to ge oza se nungai ra kamay to Nungai ko. Nungai haire. Sir, they are saying that you are great, excellent teacher.
Thank you so much.
So kuha home nag kuse. Sir, you can take a seat. Okay. Ado sum wari sum sa se ba ko. Ai brother sing sister sing ai masak ti locher age. Oza si kamay to ge experience ID ma se 20 I heard that you were the topper of 2020 the
Yeah.
FMGE exam, right? So topper na tarak pa si kamay to ge do tak have you ne some hypet some experience so. Hadi brother or sister mayam do budi daw ya na khang da mafam sa na hoji le khang da mayam hoji se le ri ba hadi mafam si da sium ba class lo we se. Ado mahaki experience na tarak pa si nungai bra hai ba na taga ma di hai bai matom pak ta chat khibra kamay to ge ba. Nungai ko. Atay tay sister hai tay kai have you ningi. Okay. So, on behalf of staying in Delhi, they are here in their home and their homely environment, and they are preparing good foods, by eating good foods and and reading is this.
That's true actually, because a lot of people usually struggle like going into a new place and definitely adjusting over there for a very short duration of 4 to 5 months. That definitely is difficult for almost a lot of people, and some people also do have their family issues. So it's better if you have access to a coaching institute which is nearby, where you can definitely get the proper guidance from the same faculties who are teaching even in Delhi. So the same faculties coming here, giving you proper guidance and strategy from time to time, and helping you out, and at the comfort of your home, if you are able to do that, that's nothing better than that, I feel.
So how did you prepare for the FMGE exam 2020? So how did you come across the exam, and how did you become the topper?
So basically was once I completed my graduation back in Kyrgyzstan, so once I returned, so one thing was for sure that I have to join an offline coaching institute. The only reason was my seniors have always been in an offline coaching institute. And at our time there was very less amount of exposure to the online platforms also. Okay. But apart from that also, like as there was COVID-19, so the online platforms just started to begin at the time of our preparations. But offline was always my say, because I was not sure whether I'll be able to definitely prepare myself on my own without any proper guidance and strategy. Because what I feel for this examination is important is not only your hard work, but it's the smart work, it's the guidance, it's the proper strategy that is going to help you pass this examination in the very first go. Otherwise, you may struggle on your own, because we may not have an idea, because the syllabus of medicine, if I consider, it is extremely vast. 19 subjects that to be completed in a short span of 4 to 5 months with proper and thorough revisions. The online platforms, but the problem happens is the course which is there, the syllabus which is there, it is vast. It is too much vast, because they have to cover almost everything, because they're not only teaching according to the examinations, but they have also they also need to think about the prof or the yearly examinations that we have back in our UG days. So they basically teach you according to that. And now if you're going to use the same content to definitely pass your FMG, or even for that matter NEET PG examinations, that becomes so vast that you're not able to complete, or even if you're able to complete, you're not able to revise. So if the same faculties come but give you a content which is definitely doable, which is more understandable, okay, and that too in your own language, and most importantly, which is revisable in a span of 2 or 3 months, definitely, that becomes much easier. Otherwise, it is extremely vast. You will never be able to compare.
I heard that MCG exam, usually in Manipur we call it MCI exam, right? MCI high kwa. So I heard that it's very tough. How did you prepare this toughness?
I don't think so. It is tough, extremely tough. Okay, yes, it is moderate to difficult, I would always say, but it is not impossible at all. The only thing, as I've told you, you need to have a proper strategy and guidance towards the examination. You have to complete all your 19 subjects. What is the thing that has started a lot in FMG is skipping a lot of subjects now. I feel these 2 or 3 subjects are less important considering the last examination, so I'm going to skip these subjects. So you never know definitely which subject is going to gain importance at any point of time. So first thing is you should never skip any kind of subject. First thing. Second important thing is a lot of people think that if I'm going to revise the content one proper time, then I'm going to be good with the content. No, it's not like that. You have to minimum give 2 or 3 revisions for the content that you have studied. Otherwise, you'll never be able to remember or recall that during the examination. And third, a lot of people struggle with the MCQ solving. They have a lot of knowledge, they gather a lot of knowledge, but they're not able to apply it. I always say one thing, that basically you have to definitely win a war. You have to be in the battlefield. You are sharpening your weapons, but you don't know how to use those weapons. So that's not going to help you, because only acquiring knowledge is not going to help you. Applying that in the form of MCQs is more important, because the exam is going to be in the MCQ or the objective manner. So these are the few things, and definitely wherever you struggle, if the faculty is sitting in front of you, first thing is if you're sitting at your home, definitely you're studying online. One notification you get, you spend your half an hour on that.
Distracted.
And then your productivity which is there, it decreases. So that happens usually. You are able to be attentive in your studies for a span of 5 or 6 hours maximum, that I would say.
Program se yam nungaiba interesting oiba session ne haina khali ko AFMG Academy for Foreign Medical Graduates ki mayam Manipur da first time ni notice su ahan bani ko se leise aduga whole entire India sida khoi gi akhanaba coaching center manga taruk lei manu sida Manipur da lei sina mayam ahan ba oi ga doi ni ko notice ki oina hai tare Kolkata da baw leite khoi sida lakchari ba institute se medical tammiba Manipur gi mapana medical tambiru ba foreign countries medical tambiru ba mayam si ki damakta di adum heaven ne haina lowe yare mafum sida kari no da waza mayam experience le ba waza mayam all over India gi topper waza mayam mafum se la ga takpiri tambiri khoi mang mayam mang do election don leibiri waza sisu mayam khoi Maharashtra da gini mark se Imphal da my 3 days class lo yare ne ba. Thank you so much sir. I heard that you come here for Imphal for 3 days, right, to cover this syllabus of surgery.
No, basically there would be 2 sessions of surgery. The first part would be general surgery, traumatology, and definitely the endocrine surgery. And once the anatomy is done, I'll be coming back for GIT and neurology.
Can you cover all the syllabus in this 3 days?
There will be a span of 6 days. There
6
will be a
days.
total class of 6 days for whole surgery, out of which 3 days the topics that I've described right now, those will be completed, and after that GIT and neurology part will be completed later.
Okay, starting from 11 a.m. till 8 p.m.
Almost 8 p.m.
8 p.m. Oh wow, how very long session, right? So how do you motivate all the students from become the yawning part, or how do you motivate
Definitely
them?
initially it's difficult for them to catch up, or initially it's difficult for them to sustain, because they have never been in these long sessions. But if you keep on giving breaks after every 1.5 to 2 hours, usually that's more effective. That they are able to
5 minutes, 10 minutes gap.
At least around 10 to 15 minutes break we give for tea, coffee, and something. So definitely they are able to sustain their attention or concentration during these longer sessions as well. And obviously in between you have to talk about the strategies and everything else, so that they do not get bored too much with one particular subject.
Okay, sir. During the past, say a few years exam, FMG exam, the officials inform me that whatever you give the suggestions to those students, it usually comes in the exam. More than 90% of the questions come from your suggestion. I heard about it. So do you know about the blueprints, or do you know any exams question setters, or so how does that magic work?
So basically, there's no connection with any examiners or something.
You don't know you don't know any
No.
personally.
We don't claim that, and I feel that's the most important thing, because claiming this, that we know the examiners and definitely we get the question papers, that's just bluffing students, because
Okay.
there is a blinding process which is going to be followed.
Uh-huh.
The only thing I feel that works is basically the first-hand experience of having attempted the FMG earlier,
Uh-huh.
and even the NPG after that.
Uh-huh.
So definitely having attempted the exam earlier, I know definitely from which topics basically, or which kind of questions they are going to ask more likely in the examinations. And obviously after studying the last year's examinations, not only the last year but definitely previous all year examinations and their question patterns, we are able to analyze like what are the kind of questions they want to or they tend to ask in the exams. So
Okay.
based on that, we definitely design our syllabus.
So I think I heard that the surgery subject is one of the major subjects, right?
Right.
So how many marks come from the surgery in all those 300 marks?
So usually out of the 300 questions, you have to score 150, and out of the 300 questions, there are 4 major subjects which usually carry 30 marks each, we could say. And one of them is surgery, another is medicine, third is obstetrics and gynecology, and fourth is community medicine or PSM.
That means from surgery part it will come
usually
30
there
marks.
are 30 to 40 questions.
30
If
to
I
40.
integrate surgery with the other minor subjects here and there, so there will be around 30 to 40 marks surely from surgery.
So how do you feel like when you come to Imphal, when you see our brothers and sisters who are sitting here and taking classes, how do you differentiate them from other students from other states? How do you differentiate
So
them?
basically, I do not differentiate students at all because that as a faculty, I do not need to differentiate between any kind of students.
Great to know
So
that.
everybody and every student sitting in my class is definitely the same.
aduna mayamda muka hanna introduce tawjage FMG Academy of Foreign Medical Graduates Imphal da hoji hangdo piriba center sidani Singjamei sigi team na lakchari se maroina koigi Manipur gi mapanda foreign countries sing da tamluba koi students sing haitare doctors oiragadauba oiragadi la oiragadaba but India gi exam mayam nam luna khanariba FMGE exam si pass tawnabo honaba matamda yam lui habsi mayam adum khanatuna su lakli mayam sound tai ta dit habiro ko luragasu mayam mafam se lakta gadi yam lai habani I think sir AFMG Academy of Foreign Medical Graduates it is given quality service for say students who are say feeling like FMG exam is very much tough. I think when they come here, the exam usually becomes easier, right?
Yeah.
So how will you explain about this?
Basically, FMG has been there for the last 20 years. It is the first institute that was established for FMG in India. So definitely with a vast experience and the faculties who have been there since a very long time now, we tend to give the quality services. The first and the foremost thing we always consider over here is whichever faculty is coming in the classes should make sure that whatever content they are giving is definitely more than enough to pass the FMG examination. It is going to cover each and everything in the FMG, not just to cut down your notes too short, definitely that it is not going to cover your syllabus, first thing. Second important, each and every student sitting in the class should understand what the faculty is speaking, what the faculty is teaching. That's the reason whatever doubts they have, we always ask the students to reach out to us, to get back to us, get their doubts clarified in each and every break that we have, or even after that we are in constant touch with students. So even if they reach out to us at any point of time, definitely we are always there to answer their doubts.
So how will you train our students? Like in 2020, you have topped the exam, right? So do you teach them to imitate your reading style, or how do you teach them?
Basically, I don't think so. Imitation is going to help, and that's the most basic problem that a lot of FMGs face. Because once they begin the preparation, the first thing that they do is search on YouTube that how to pass the FMG examination and the strategies.
Exam thikwa. The exam say kamay pass tawdun FMG exam say. So what is the simplest advice, the suggestion you will
So
give in
that-
order to pass the exam?
That I was approaching basically because once you are over here with us, we know definitely we try to understand each and every student and we try to give strategies which are going to work for that student individually. Because once as a student, if I'm going to tell my strategy, obviously that may work for some of the students, that may not work. Maybe, for example, if I'm having a sitting ability of almost 3 hours, I'll say that definitely sit for 3 hours and then only take a break. Other person has just started, he may not be able to sustain his attention for a span of more than 1 hour. So he may be in that guilt that I am not able to study or all of that. So basically one strategy is not going to work for everybody. So that's the reason I always said that the constant guidance is more important, basically because whatever difficulties you are facing in your preparation journey individually, you should get the solutions for those particular difficulties rather than following a one single strategy. But the one thing that I always say, basically there is no magical strategy for FMG. One thing I always say, there are 4 hours to pass this examination, and that is nothing else but read, revise, retain and recall. That's it. So whatever you have read throughout the day, you have to revise it properly and thoroughly multiple number of times so that you remember it and you are able to recall that properly in the examinations. That is what is more important.
I think that giving multiple exams, like I have seen a video in YouTube today only I have seen it from one of the South students. He has passed the exam after appearing for the 28th time, right? I think it will give some motivation to the students also, right?
Right.
So I think I heard that some students are being ashamed of being showing the faces to the public. So I'm not asking them to show the faces or not. I'm not asking, but generally I heard that students are reluctant to show their faces. That we are applying here. This and any advice from your side?
That's because a lot of people feel, most of them are not able to digest the failure somewhere, and I feel you have to accept and digest the failure and move forward, because the more time you are going to be involved in that, or you are going to be stuck in this basically, you will never move forward in life. So if you have to move forward in life, if you have to plan your life further, you have to get over it at some or the other point. Okay? And people are always going to judge. So nobody, as I always say, definitely, nobody is going to come to your home, nobody is going to earn the bread for you. It's you basically and your family which matters at the end of the day. So that's the reason I always say, after the examination is done, one advice that I always give to the parents basically is, it's you whose support is majorly required for the students. It's not any other person in the world that they need to support them. The only thing and the only expectation they have, that our parents support us or our family supports us. They do not care about the world. Maybe some of them do initially, but after a point of time, definitely that becomes very insignificant for them, that what people think about them. So, but at the end of the day, I always say that you have to make sure that you, whatever you are doing for yourself, this examination preparation that you are doing, it's not merely for the examination. It's basically going to, you are going to earn your bread and butter for life from this preparation itself. And secondly, I always say, work hard for those 2 smiles which you are going to see on the result day, because every sacrifice is going to be worth for those 2 smiles that have sacrificed everything for you for the last 6 to 7 years.
Let me ask some questions. Whether handak exam thabi se kaya subo ido no sum free dum hai se sak mai kam utpana te just free dum share to
I just handakti thadre.
hadriya handak na first time lo
First time din natte repeater.
So exam se dum generally dum lubra ojana budi hai re exam is very much not that much tough na hai ko exam se lubra kamai to aina sum taja badi public tai sum ta bani ko exam se am lui hai basing bade dum tai ado kamai to student side tai sum taning bai ta exam se lubra hai basini
Lubadi dum lui ado recall tawbase waba exam manungda nomada subject trampan tawna recall tawbase waba di matak tamka skill jesu khara MCQ tawnaba skill je khara improve hanba adu hata.
So the exam is not much that difficult, but recalling the subjects is very, I think it's 19 subjects, right? So recalling all those papers within say 2 hours, or right? 2 hours time, it's very tough, I think. So do you have any suggestions or advice regarding that? And he's saying that attempting MCQs questions within the very short period of time is very tough also.
That's the reason I always say MCQ solving is an art which has to be learned with time, practice and mistakes. I always say and reiterate that fact, because MCQ solving you're not going to learn in one day. That's the reason I always ask them to start solving MCQs from the day one of their preparations itself, so that if they are solving 60 to 100 MCQs on a daily basis throughout these 4 to 5 months, they will be in a state definitely when they are able to approach that MCQs much easily. Why? Because MCQ solving, man, you need to be strategic more. You have to pick up those keywords, basically those 4 to 5 keywords in your question which make your diagnosis easier, and once you have made your diagnosis, then definitely coming to the answer or ruling out options becomes much easier. So this MCQ solving approach which is there, if you learn it once, it is not going to only help you in FMG, but even in a lot of other examinations that you're going to appear.
Similar questions do come, or what? The same type of questions do come repeatedly, or what?
Exactly, not the same ones, but yeah, similar I would say, because it is not the previous year questions exactly with the same question and same options, but it is the previous year topics which are going to be repeated. They may ask you the question from the same topic. Maybe last time they have asked you about the diagnosis, this time they may ask you about the cause of that particular disease, right? Or maybe, as I've told you, that the question may seem exactly the same, but even if I include or deduct one word from that question, the answer of that question may change, because medicine is definitely somewhat or a bit tricky in this regards. That if I'm able to, or if I'm even able to definitely going to frame the language of that question differently, people are going to have a lot of difficult time to answer that question.
Okay, thank you so much. That was a high do. No matter preparation MCQ is around 50 to 100 try to be high. MCQ questions in nine things that PDF thada try to tareko. Sister som na kandong ta hange sister kaya subet them to 100
first attempt tawdoine.
first attempt. So, okay. Ado si mapam sida isum tao the first attempt yam phawgal le hai. Wish you all the best. Kidi ki bra exam tha sa FMG se.
Okay.
She's saying that she's afraid of giving this FMG exam. So any advice to her?
Fear basically is definitely going to be
This
there.
is this is her first time.
I don't say that anxiety is not going to be there because she has just started the preparation. Obviously, all the faculties will be coming, all the subjects will be discussed one by one. And with each and every subject and their revisions and the MCQ solving, she will definitely be improving her strike rate. And once the strike rate gets better with time in the MCQ solving part, she will gain that confidence somewhere or the other and the fear somewhat decreases. I will not say that the anxiety completely disappears. It is never going to disappear.
Okay,
But
thank
you learn to control that.
Thank you. Sister ki kya rak subano first time.
ꯑꯩꯒꯤ ꯁꯦꯀꯦꯟ ꯑꯦꯇꯦꯝꯅꯦꯕ
Second attempt, first attempt to haidi mark kyamu what hoge num week oigibra kamai tawi.
ꯐꯥꯔꯁ ꯑꯦꯇꯦꯝꯁꯦ ꯑꯩꯒꯤ ꯀꯩꯅꯣ ꯇꯧꯈꯤꯕꯒꯤ ꯀꯣꯆꯤꯡ ꯐꯖꯅ ꯌꯥꯎꯈꯤꯗꯦꯕ ꯑꯩ ꯏꯁꯥ ꯏꯊꯟꯇ ꯁꯦꯜꯐ ꯄ꯭ꯔꯤꯄꯦꯔꯦꯁꯟ ꯇꯧꯕ ꯑꯗꯨꯒꯤ ꯃꯤꯁꯇꯦꯛꯇꯣ ꯑꯩ ꯂꯔꯟ ꯇꯧꯔꯒ ꯍꯟꯗꯛꯇꯣ ꯀꯣꯆꯤꯡ ꯐꯖꯅ ꯐꯨꯜ ꯔꯤꯒꯨꯂꯔ ꯀ꯭ꯂꯥꯁ ꯌꯥꯎꯔꯒꯦꯅ ꯈꯜꯂꯦꯕ ꯑꯗꯨꯒ ꯑꯣꯖꯥꯁꯤꯡꯁꯤꯗꯒꯤ ꯃꯥꯒꯤ ꯄꯤꯕ ꯅꯣꯠꯁ ꯅꯨꯡ ꯃꯌꯥꯝꯗꯣ ꯑꯗꯨꯗꯣ ꯇꯧꯔꯒ ꯐꯖꯅ ꯑꯃꯨꯛ ꯄ꯭ꯔꯤꯄꯦꯌꯔ ꯇꯧꯔꯒꯦꯅ ꯈꯟꯕ.
So my sister, she has appeared the exam once. Okay, this is her second time. In the previous exam, she didn't take any support from the coaching side or any other professional teacher. So this is her second time, and she is trying her best to give the best in the coming exam. So I think she's like a fresher in this institute, right? The first time after joining this institute. So any advice to her?
The only thing that I've told them while I was beginning the class also that whatever doubts you have, whatever problems that you are facing, you have to reach out to us. Because if you're not going to be vocal about your problems or your doubts, the faculties are not going to understand on their own. They have a lot of students definitely, but if you reach out, it's surely that we are going to give you solutions for each and every specific problem that you are going to face. So we are there for you till the end. As I always say, basically in AFMG, we do the hand holding till the day of your examination also.
Ado sida lay bi mayam sida khara attempt khatang yam bam tang wari sajage personally natte sum haidi mayam gi journal loiba sum ai khatang mon dagi tips loning ba hai tare kadogumba koi gi 4 5 times 6 7 8 9 times suba khatang hai bi yone first second third kum nataba khatang yam na appear to bi ra ba hai tare am tang khut thanga pi yone ai personally ai video sum mon tho tham jari sum sir dagi tang ai suggestion lawjaning ba hai tare but kya rak subire ahum lak sure mari rak suba manga rak suba yawraba kisu kai dia du experience ne loge haise ado brother third time su bane bako first time second time se kamaina haidi experience togi question to dum lu khibra mark kaya mu kadi wa laga mark se dum haiba yabra ai sakming adu da kem utte ko
ꯑꯍꯥꯟꯕꯒꯤꯗꯤ ꯃꯥꯔꯛꯇꯣ 130 ꯃꯨꯛ ꯐꯪꯖꯩꯕ ꯑꯗꯨꯗ ꯀꯣꯆꯤꯡꯁꯨ ꯐꯖꯅ ꯌꯥꯎ ꯉꯝꯖꯍꯧꯗꯕ
haidi khanghoudaba haita sim phangse
ꯊꯣꯛꯂꯛꯄꯗꯣ ꯈꯤꯇꯪ ꯈꯣꯏꯌꯧꯅꯕꯗ ꯑꯗꯒꯤ ꯊꯣꯛꯂꯛꯄ ꯀꯣꯚꯤꯗꯀꯤ ꯃꯇꯝꯒꯤꯁꯨ ꯑꯗꯨꯝ ꯍꯥꯏꯕꯗꯤ ꯀꯩꯀꯥ ꯆꯠꯄꯩ ꯈꯣꯠꯄꯩꯁꯨ ꯈꯔ ꯕꯦꯔꯥ ꯂꯩꯈꯤꯕ ꯑꯗꯨꯁꯨ ꯇꯧꯈ꯭ꯔꯦ ꯑꯗꯨ ꯑꯅꯤꯔꯛ ꯁꯨꯕꯒꯤꯗꯨꯅ ꯑꯗꯨꯗꯅ 140 ꯑꯗ ꯑꯃꯨꯛ ꯐꯪꯉꯦꯀꯣ ꯑꯗꯨꯒ ꯍꯟꯗꯛ
140 ꯑꯣꯏꯗꯤ mark 10 ꯈꯇꯪ ꯋꯥꯠꯂꯤꯅꯦ ꯑꯗꯨ ꯀꯃꯥꯏ ꯋꯥꯠꯂꯤꯅꯦ ꯌꯥꯝ ꯂꯨꯕ꯭ꯔꯥ ꯁꯤꯅꯦ ꯑꯩꯅ ꯈꯪꯅꯤꯡꯉꯤꯁꯦ
ꯃꯣꯏꯒꯤ ꯀꯩꯅꯣꯅꯤ
ꯈꯔ ꯂꯥꯏꯊꯣꯛꯈꯤꯕꯩꯔꯥ ꯅꯠꯇ꯭ꯔꯒ
ꯑꯩ ꯀꯣꯏꯁꯟ ꯈꯔ ꯂꯧꯗꯕ ꯑꯗꯨꯗ
ꯀꯔꯝꯕ question ꯀꯩ subject
ꯍꯥꯏꯗꯤ ꯀꯩꯅꯣꯗ ꯐꯣꯀꯁ ꯇꯧꯔꯤꯉꯩ ꯊꯤꯑꯣꯔꯤꯗ ꯐꯣꯀꯁ ꯇꯧꯔꯤꯉꯩꯗ ꯀꯣꯏꯁꯟꯁꯤ ꯍꯣꯠꯄ ꯅꯪꯍꯧꯗ꯭ꯔꯦꯕ ꯑꯗꯩ ꯀꯣꯏꯁꯟꯁꯤ ꯈꯔ ꯇꯧꯍꯧꯗ꯭ꯔꯦ ꯑꯗꯨꯒ ꯍꯟꯗꯛ ꯑꯍꯨꯝꯂꯛ ꯁꯨꯕꯩꯁꯤꯅꯅꯦ ꯍꯟꯗꯛꯅ 147 ꯐꯪꯉꯦꯕ ꯑꯍꯨꯝ ꯋꯥꯠꯂꯦꯕ ꯍꯟꯗꯛꯁꯤꯅ ꯑꯗꯨꯒ ꯀꯣꯏꯁꯟꯗꯤ ꯍꯣꯠꯂꯦ ꯑꯗꯨꯅ ꯑꯗꯨ ꯈꯪꯗꯦ ꯗꯥꯎ ꯌꯥꯗꯕ ꯍꯥꯏꯗꯣꯏꯔꯥ ꯀꯩꯗꯅꯣ ꯈꯪꯗꯦ.
So sir, this brother he has experienced this exam 3 times. So one he has scored about 130. So the second time 144, and the last time 147 like that.
Right.
I think only 3 marks will give this students the failure say experience, right? So he might be demotivated, right?
True.
So any motivation from you, and he has appeared multiple exams.
The first thing that they have to remember is basically I always say if you are in the 140 range, that does not mean that you are not prepared well. It may be that the luck or the destiny was not in our favor. But considering that as one point, the second point that we always have to remember, because a lot of people in the 140 range, when they start preparing again, one thing they always tend to have definitely have there in the head, that as they read the notes, definitely they tend to think, yeah, this I know already. So why do I need to revise? So a lot of them definitely close their books and they get to most of them definitely get off track. That is the only thing that they should have to keep in mind, that even if I have read a lot in the last attempt, that's not going to matter. I have to start all over again. So if they keep that hope definitely, or if they have that faith in themselves ignited and the spark ignited throughout the preparations, definitely. It will be much easier. There will be a lot of emotional loads. So I always ask them to reach out to their family, friends, to us, basically, but be motivated throughout the journey.
Okay. Sister ki di kya rak sure handak exam tha the first time la. Okay, you are from Tripura. Okay, nice to meet you. So this is the first time you are getting into this coaching center, right? So have you appeared the exam, FMGE exam? This is the first time. So how is your preparation going on?
Today is the starting day, so we are just studying, and sir is giving us good guidance also, along with the document, along with the notes and all. We are preparing all. That's all.
So how is Manipur to you?
Manipur. For now, I have been only staying in my room. I have never went outside.
You need to go sometimes along with your friends. You can go sometimes outside your room also. You have to experience the air also, right? You have to experience the market also. You have to experience new friends, right? So wish you all the best for your stay and welcome to Imphal once again. Sister, kaya kaya sure. So mau just makan masing lang happy.
Yame.
Ha.
Yame ba?
Yame. Masing lang happy. Ay masak em utte maming so hamoy. Just masing lang happy ro duga kari problem thing na bigi bage. We will haidi sir so lay dana. Guide to jaran do koi mai kai to best wishes.
I do coaching phasana yahode ba. Ana handak phasana yahor going to again.
Okay. My sister, she is saying that she has appeared exams several times, and I feel like she is a little bit shy of saying that she has appeared the exam multiple times and she didn't make up to the mark. So I don't think that it's not being shameful for not clearing the exam, right? So this is how students in Imphal are feeling. I think some of the students are reluctant to go to the coaching center also.
That's true.
Very reluctant to show the faces to the friends or any. So,
Most
any advice from
importantly,
you?
A lot of people, as I've told you, that I'm not sure why they are having so much hatred or why they are definitely so hesitant to join coaching. Our seniors, like the one thing is in medicine that you have to remember, in medical profession, the only person that you should seek advice from is nothing else but your seniors. And our seniors told us one thing, that go back to India, join a coaching and sit over there in the classes. Though I have been reading textbooks throughout my UG days for the last 5 years of my UG days, but I was pretty sure that I'll not be able to do it on my own. So there is no hesitation of getting definitely a good guidance or definitely a proper strategic approach from the faculties who have that experience of tutoring or mentoring a lot of students throughout the years. So I feel it's more important they have to decide. A lot of times it happens basically based on the experience of their friend or colleague. What they think is that he was able to do it from online platform, so I'll also be able to do it. As I've told you that not all the people are same. Maybe he was able to sustain that attention for that such long time, and that worked in his favor. It's not going to be same for everyone. Maybe that has not worked for you, and if it is not working for you, you should not keep on taking chances. A lot of people have seen, ठीक है, online से नहीं हो रहा, I'll definitely change the platform. Okay, वहाँ से नहीं हो रहा, I'll definitely go to YouTube. वहाँ से नहीं हो रहा, I'll definitely change the PDFs. But they are very hesitant, and almost after 2 or 3 attempts, what happens is now juniors start coming in the institute, and now they are definitely shy to sit with their juniors. I don't think so. Ultimately, at the end of the day, I always say, if you are in class, definitely you are here to learn something. You don't have to think what the next person is going to think or what the next person is going to judge. I always ask them to scream out in my classes.
Okay. Sir, na haise isab sama daka oi de habedo. Daka oi de moina khoi dam tamating kam pang bia kadau nate. Akhoi honabam thopu honar loire ai mangarak thagera, tararak thagera, pass or yar metro. Pass over the neighbor Queen like Kurmission track, no honoriba, to the coaching centers in Nomada, not less than 10 hours, and a pump is in my partner, and Nabagina Maktaneba. I know brothers, sisters in the Ayam Kangway Hazabina, so they want the experience of a day. Sir Sisu, master experience, I'm there, the moment the confidence be with Hotai. I sisters, master confidence watcher is among the some exam to Taraga, pastor to have begis among the confidence at what Jaybo. Although operation tomatamda, surgery tomatamda, patient doctor Gimarta relation, Amalay, sisters in brothers in Kanganiqua. Patient ga doctor sigagi mari se kari ma good relation or wari watai sadana phasan chat khraba operation si yam mai pakal le hai aisu handak recently operation tawi doctor da su hairak pani ko ado atop doctor da su sigi wari sidum li na khoina sudum li du ne patient doctor relationship am laini natra patient doctor relationship confidence wang ta di so 100% successful oi ga do ne operation se kari gumba ꯑꯩꯈꯣꯏꯒꯤ ꯑꯣꯄꯔꯦꯁꯟꯗꯣ ꯃꯥꯏ ꯄꯥꯛꯂꯛꯇ ꯇꯥꯔꯗꯤ ꯋꯥꯔꯤ ꯈꯛꯇꯪ ꯍꯪꯒꯠꯂꯨꯕ ꯃꯇꯝꯗ ꯄꯦꯁꯦꯟꯗꯣ ꯗꯣꯛꯇꯔꯗꯣ ꯄꯥꯎ ꯈꯛꯇꯪ ꯐꯥꯎꯅꯍꯧꯗ꯭ꯔꯦ ꯍꯥꯏꯕꯁꯤ ꯌꯥꯝ ꯀꯃꯟ ꯑꯣꯏ ꯍꯥꯏꯇꯥꯔꯦ ꯑꯩꯅ ꯍꯥꯏꯖꯅꯤꯡꯉꯤꯁꯦ ꯑꯩꯅ ꯔꯤꯂꯦꯠ ꯇꯧꯖꯅꯤꯡꯉꯤꯁꯦ ꯀꯩꯝ ꯅꯠꯇꯦ ꯁꯥꯔ ꯂꯩꯔꯤ ꯁꯥꯔꯁꯤꯒꯤ ꯑꯩꯅ ꯁꯨꯝ ꯒꯥꯏꯗꯃꯛꯇꯤ ꯄꯤꯕ ꯅꯠꯇꯦ ꯃꯅꯤꯄꯨꯔꯗ ꯂꯩꯕꯤꯔꯤꯕ ꯃꯄꯥꯟꯗ ꯐꯣꯔꯦꯟ ꯀꯟꯇ꯭ꯔꯤꯁꯇ ꯑꯩꯈꯣꯏ ꯃꯦꯗꯤꯀꯦꯜ ꯇꯝꯃꯨꯔ ꯂꯥꯛꯄꯁꯤꯡꯁꯦ ꯃꯅꯤꯄꯨꯔꯗ ꯁꯨꯃꯥꯏꯅ MCI ꯑꯦꯛꯖꯥꯝꯁꯦ ꯁꯤ ꯄꯥꯁ ꯇꯧꯅꯕꯗ ꯌꯥꯝ ꯋꯥꯏ ꯍꯥꯏꯁꯦ ꯃꯇꯣꯝꯗ ꯁ꯭ꯇ꯭ꯔꯒꯜ ꯇꯧꯔ ꯂꯩꯖꯕꯗꯣ ꯃꯐꯝꯁꯦ ꯂꯩꯔꯦ ꯍꯥꯏꯕꯒꯤ ꯅꯨꯡꯉꯥꯏꯕ ꯄꯥꯎꯁꯤꯗ ꯕ꯭ꯔꯗꯔ ꯁꯤꯁꯇꯔ ꯃꯌꯥꯝꯒꯤ ꯃꯇꯦꯡ ꯂꯧꯖꯕꯩ ꯋꯥꯅꯦꯕ ꯃꯥꯏ ꯄꯥꯛꯄꯁꯨ ꯃꯌꯥꯝ ꯌꯥꯎꯈ꯭ꯔꯦ ꯃꯥꯏꯊꯤꯕꯁꯨ ꯃꯌꯥꯝ ꯌꯥꯎꯒꯅꯤ ꯃꯥꯏ ꯄꯥꯛꯄꯁꯨ ꯑꯣꯏꯔꯛꯈꯤꯅꯤꯕ ꯑꯩꯅ ꯍꯥꯏꯖꯅꯤꯡꯉꯤꯁꯦ ꯁꯥꯔꯗ ꯑꯗꯩ ꯂꯩꯔꯤꯕ ꯃꯌꯥꯝꯁꯤꯗ ꯀꯟꯐꯤꯗꯦꯟꯁ ꯕꯨꯁ ꯇꯧꯃꯤꯟꯅꯁꯦ ꯍꯥꯏꯕ ꯁꯣ ꯗꯦꯠ ꯀꯩꯗꯧꯔꯦ ꯀꯟꯐꯤꯗꯦꯟꯁ ꯐꯪ ꯇꯥꯔꯗꯤ the chance of getting successful is very much higher, right? So confidence paame habanida. So I was just seeking their confidence from their side to the teacher, right? If there is no confidence to the teacher, if there is no confidence while coming to the media, or I'm just like a media, so I want just some sort of confidence from their side. So I didn't get that confidence. So I'm not happy for that reason. So confidence is the key, and Haining is say confidence will be the key part in getting the examination done from your side, and exam se pass on hona matamda. So from our side, wish you a very good luck, sir, and thank you so much for your time. Thank you so much for your. Okay, kay pa. Okay. Okay. Kay pidoy no hairo. Ana haise. Ai gyan ta de nang haije lai se. Ngasai gi exam pass to gi brother ko silai se to I don't know what we will. Okay. Aha. Aha. What's that ceremony called? I don't know. I didn't have much knowledge about it. So what's this?
FMGE the Delhi the show dum tawbodo moi FMGE coaching manung dei pass tawbase moi certificate amaga medal amga pieba dum moi coaching
Okay.
ado
Alo atay guys isu sumaina one day ngamakadoi ni ko ngamoy da binate one day everybody will get through this exam, right? Sure. So a very good luck to all the students of this institute, and a very good luck to you, sir, also. Thank you so much for your time, and everybody, thank you so much. Congratulations, ko. Yam nungay re. Thank you so much, Mike. Please take your time, okay? Ay nga hagi ko brother sister mayam. Thank you so much. Mayam akhoi classroom dang hak chang mani ko classroom sidang hak disturb tawre kai you know da khoi khangning ba mayam lei ba hai tare experience lai bo jasna su mana haira ko mayam se khoi da yam nei interesting yam oi sir khoi classroom se chang matam da yam nungai bi men sang phangi haidi exam se pass taw da tawro do ma le yam chaw service ama saroi gi nep size studies na zum pv ri ko yam nungai do sida lei ba facility sing se apart from classroom alai kai kai
ko hostel su thamje hostel sida lai re
classroom Oh, hostel se sigi same building se moi one.
Mathak ta su lai re se ground se na first floor da ni ko.
Aha.
Se first floor da ne. Yani.
Sai ya ma de lo wi ki ko. Pesom mi rom do yek han bagi. Okay. Mayam akhoi na haidi hostel gi oiba typical room ama akhoi na dum share tawna na bagi khudong cha baduma akhoi lawjage typical hostel room hai tare. Yani ko. Ai masakti uchara roge ko. Okay, aduga sida lai sina typical room hai sida mi mayam Facebook ki anobo bak amani se ko haidi live se sound se bat tat pa hai tare net hek tat pa ga ado mayam khoi continue tau jage ado sar na sumatam kai thok piraga sumaina net science institution sida sida koi sumaina koi gi service mayam pibi base yam nungai ado kari wakhalon dagi sumaina sigi service se hodok ke haina khanbi rakhi bano do su yam nungai am do male wari se
taseng na isi career consultant tau ni net education consultancy na ado angang sing si sung kai tau rau ka lai gonda Manipur macha medical mapana tamuraga halakpa kanda awaba face tama tauba Delhi gumna coaching chatpa kanda huge amount ma sangba ade lifehome safam ade koi notice people singsi saksu manata bagi discriminate oiba khotpa mainland India kitang su mislei dagi aina Delhi de chatpa kanda su awaba mayam si thengna padagi aina Manipur su ma tawfam thoina na ai citizen of Manipur oina ai Manipur gi kenomdi tawrongge haibi khalonda
yam sawi initiative ni
adu sigi jaina pura lakhi bani ado laibak yam phabamna AFMG coaching institute Delhi da lerisina franchise fee for low dabida I go on the full support of biraga ngasi first base loike second base uju chathari se ado masi wakhal wonda ina Manipur gi angang sing sida ꯀꯩ ꯍꯥꯏꯅꯤ ꯃꯇꯦꯡ ꯄꯥꯡꯕꯤꯕ ꯁꯥꯇ꯭ꯔ ꯃꯌꯥꯝꯁꯤꯗ ꯃꯇꯦꯡ ꯄꯥꯡꯕꯒꯤꯗꯃꯛꯇ ꯑꯩ ꯍꯥꯡꯈꯤꯕꯅꯤ ꯑꯗꯨ ꯃꯅꯤꯄꯨꯔꯗ ꯂꯩꯕ ꯀꯥꯟꯗ ꯄ꯭ꯂꯁ ꯄꯣꯏꯟ ꯃꯌꯥꯝ ꯑꯃ ꯂꯩ ꯀꯩꯒꯤꯅꯣ ꯍꯥꯏꯕ ꯀꯥꯟꯗ ꯃꯅꯤꯄꯨꯔꯗ ꯂꯩꯕ ꯑꯁꯤ ꯋꯦꯗꯔ ꯅꯨꯡꯉꯥꯏꯔꯦ ꯆꯥꯕ ꯊꯛꯄ ꯅꯨꯡꯉꯥꯏꯔꯦ ꯍꯣꯝ ꯇꯥꯎꯟꯗ ꯂꯩꯔꯦ ꯑꯗꯨꯗꯒꯤ ꯗꯦꯜꯂꯤꯗ ꯀꯣꯆꯤꯡ ꯇꯧꯕ ꯆꯠꯄ ꯍꯥꯏꯁꯤ ꯑꯦꯛꯁꯄꯦꯟꯗꯤꯆꯔ ꯌꯥꯝꯅ ꯋꯥꯡꯉꯤ ꯑꯦꯛꯁꯄꯦꯟꯗꯤꯆꯔ ꯋꯥꯡꯉꯤꯁꯤ ꯀꯩꯒꯤꯅꯣ ꯍꯥꯏꯕ ꯀꯥꯟꯗ ꯃꯣꯏꯒꯤ ꯁ꯭ꯇꯦꯠꯇꯨ ꯆꯥꯎꯈꯠꯄ ꯁ꯭ꯇꯦꯠꯅꯤꯅ ꯑꯩꯈꯣꯏꯒꯤ ꯗꯦ ꯇꯨ ꯗꯦ ꯌꯨꯖꯦꯁꯁꯤ ꯌꯥꯝ ꯇꯥꯡꯕ ꯑꯗꯨ ꯁꯤꯗ ꯂꯩꯔꯒꯗꯤ ꯑꯗꯨꯒꯨꯝꯕ ꯃꯌꯥꯝ ꯑꯃ ꯃꯦꯔꯤꯠ ꯗꯤꯃꯦꯔꯤꯠ ꯃꯌꯥꯝ ꯑꯃ ꯂꯩꯔꯦ ꯑꯗꯨꯒ ꯗꯦꯜꯂꯤꯗ ꯀꯣꯆꯤꯡ ꯌꯥꯎꯕꯒ ꯁꯤꯗ ꯌꯥꯎꯕ ꯄ꯭ꯂꯁ ꯃꯥꯏꯅꯁ ꯈꯔ ꯂꯩ ꯗꯦꯜꯂꯤꯗ ꯌꯥꯎꯕꯗꯗꯤ ꯀ꯭ꯂꯥꯁꯔꯨꯝ ꯑꯃꯗ ꯃꯤ 300 ꯐꯝꯃꯦꯕ ꯑꯩꯈꯣꯏ ꯁꯤꯗꯗꯤ ꯁ꯭ꯃꯣꯜ ꯕꯦꯁꯅꯦꯕ ꯁ꯭ꯃꯣꯜ ꯕꯦꯁꯅꯤꯅ ꯁꯥꯇ꯭ꯔ ꯌꯥꯝꯗꯕꯅꯤꯅ ꯑꯣꯖꯥꯒ ꯏꯟꯇꯔꯦꯛ ꯇꯧꯕ ꯌꯥꯕꯒꯤ ꯌꯥꯝ ꯆꯥꯎꯕ ꯀꯔꯤ ꯑꯃ ꯂꯩꯖꯩ
ꯍꯣꯏ ꯍꯣꯏ ꯌꯥꯝ ꯅꯨꯡꯉꯥꯏ ꯑꯗꯣ ꯑꯣꯖꯥꯅꯁꯨ ꯁꯨꯃꯥꯏꯅ ꯄꯨꯁꯜꯂꯛꯄꯤꯗꯅ ꯃꯅꯤꯄꯨꯔꯗ ꯍꯥꯏꯇꯥꯔꯦ ꯑꯣꯜ ꯑꯣꯚꯔ ꯏꯟꯗꯤꯌꯥꯗ ꯀꯌꯥꯅꯣ ꯕ꯭ꯔꯥꯟꯁ ꯂꯩ ꯍꯥꯏꯕꯗꯣ ꯈꯔ
ꯑꯣꯜ
ꯀꯔꯤ
ꯑꯣꯚꯔ ꯏꯟꯗꯤꯌꯥꯗ ꯕ꯭ꯔꯥꯟꯁ 6 ꯂꯩ ꯑꯗꯣ ꯏꯝꯐꯥꯜꯗꯅ ꯂꯥꯁ ꯕꯦꯁꯇꯩ ꯍꯧꯕꯅꯤ ꯑꯗꯣ ꯁꯦꯝ ꯑꯣꯖꯥꯁꯤ ꯁꯦꯝ ꯑꯣꯖꯥ ꯗꯦꯜꯂꯤꯗ ꯂꯩꯔꯤꯕ ꯑꯣꯖꯥ ꯂꯣꯏꯅꯃꯛꯁꯦ ꯁꯤ ꯕ꯭ꯔꯥꯟꯁ ꯂꯣꯏꯅꯃꯛꯇ ꯆꯠꯂꯒ ꯇꯥꯛꯀꯗꯣꯏꯅꯤ ꯁꯦꯝ ꯗꯦꯜꯂꯤꯒꯤ ꯐꯦꯀꯜꯇꯤꯁ ꯃꯌꯥꯝꯗꯨ ꯂꯥꯛꯑꯒ
ꯍꯥꯏꯗꯤ ꯁꯤꯒꯤ ꯁ꯭ꯇꯨꯗꯦꯟꯁꯤꯡꯁꯤꯅ ꯗꯦꯜꯂꯤꯗ ꯆꯠꯂꯒ ꯇꯝꯕꯒ ꯆꯞ ꯃꯥꯟꯅꯗꯣꯏꯅꯦꯕ
ꯗꯦꯜꯂꯤꯗ ꯇꯝꯃꯤꯕ
ꯑꯣꯖꯥꯁꯤꯡꯗꯣ ꯆꯞ ꯃꯥꯟꯅꯕꯅꯤꯅ
ꯁꯦꯝ ꯁꯤꯂꯦꯕꯁ ꯁꯦꯝ ꯂꯥꯏꯔꯤꯛ ꯁꯦꯝ ꯕꯨꯛ ꯁꯦꯝ ꯇꯤꯆꯔꯁ ꯂꯣꯏꯅꯃꯛ ꯆꯞ ꯃꯥꯟꯅꯩ ꯑꯗꯣ ꯐꯦꯁꯤꯂꯤꯇꯤꯁꯨ ꯁꯤꯗꯅ ꯍꯦꯟꯅ ꯌꯥꯝ ꯐꯪꯉꯤ ꯗꯦꯜꯂꯤꯗꯅ ꯀꯣꯆꯤꯡ ꯏꯟꯁꯇꯤꯇ꯭ꯌꯨꯠ ꯑꯃꯒ ꯑꯗꯒꯤ ꯂꯥꯏꯕ꯭ꯔꯦꯔꯤꯒ ꯍꯣꯁꯇꯦꯜꯒꯁꯦ ꯑꯝꯇ ꯄꯨꯟꯗꯦ ꯑꯩꯈꯣꯏꯒꯤꯗꯤ ꯁꯦꯝ ꯕꯤꯜꯗꯤꯡꯁꯤꯗ ꯍꯣꯁꯇꯦꯜꯅꯦ ꯂꯥꯏꯕ꯭ꯔꯦꯔꯤꯅꯦ ꯀ꯭ꯂꯥꯁꯔꯨꯝꯅꯦ ꯁꯦꯝ ꯕꯤꯜꯗꯤꯡꯗ ꯄꯨꯜꯂꯤꯅꯤ ꯑꯗꯨꯒꯤ ꯄ꯭ꯂꯁ ꯄꯣꯏꯟ ꯑꯃ ꯐꯪꯉꯦ ꯑꯉꯥꯡꯁꯤꯡ
ꯍꯣꯏ ꯁꯤꯒꯤꯁꯤ ꯅꯨꯡꯉꯥꯏꯕꯁꯨ ꯑꯃ ꯂꯩꯔꯦ ꯑꯗꯨꯒ ꯑꯣꯖꯥꯁꯤꯗ ꯄꯤꯕꯤꯔꯤꯕ ꯐꯦꯁꯤꯂꯤꯇꯤꯁꯤꯡꯁꯦ ꯍꯣꯏ ꯉꯁꯥꯏꯒꯤ ꯑꯉꯥꯡ ꯅꯨꯄꯤ ꯃꯆꯥꯁꯤꯡꯁꯤꯒꯤ ꯁ꯭ꯇꯨꯗꯦꯟꯁꯤꯡꯁꯤꯒꯤ ꯑꯣꯏꯕ ꯔꯨꯝ ꯑꯃꯗ ꯃꯈꯣꯏ ꯑꯅꯤ ꯁꯦꯌꯔ ꯇꯧꯕꯒꯤ ꯑꯣꯞꯁꯟꯁꯤꯃ ꯂꯩꯔꯦꯀꯣ
ꯇꯦꯕꯜ ꯑꯃ ꯆꯤꯌꯔ ꯑꯃ ꯄꯤꯔꯦ ꯑꯗꯨ ꯋꯥꯏꯐꯥꯏ ꯐ꯭ꯔꯤ ꯄꯤꯔꯦ
ꯑꯣꯀꯦ ꯋꯥꯏꯐꯥꯏꯁꯨ ꯑꯗꯨꯝ ꯐꯪꯒꯗꯣꯏꯅꯤꯀꯣ ꯃꯌꯥꯝ ꯃꯌꯥꯝ ꯁꯨꯃꯥꯏꯅ ꯁꯤꯒꯤ ꯁꯔꯚꯤꯁ ꯀꯩꯁꯦ ꯂꯩ ꯑꯗꯨꯒ ꯃꯣꯏꯒꯤ ꯆꯥꯕ ꯊꯛꯄꯒꯤ ꯍꯥꯏꯇꯥꯔꯦ ꯀꯤꯆꯟꯒꯗꯤ ꯎꯗꯦꯕ ꯀꯤꯆꯟꯒꯤꯁꯤꯗꯤ ꯀꯃꯥꯏꯅ ꯇꯧꯋꯤ ꯑꯣꯀꯦ ꯃꯊꯛꯇ ꯑꯗꯨꯝ ꯍꯥꯏꯗꯤ ꯇꯣꯞ ꯐ꯭ꯂꯣꯔꯗ
ꯗꯥꯏꯅꯤꯡ ꯍꯣꯜꯁꯨ ꯂꯩꯔꯦ ꯑꯗꯣ ꯄꯤꯊꯛꯄꯁꯦ ꯑꯩꯈꯣꯏ ꯐꯖꯅ ꯄꯤꯖꯩ ꯃꯦꯅꯨꯁꯤ ꯀꯩꯒꯤꯅꯣ ꯍꯥꯏ ꯀꯥꯟꯗꯗꯤ ꯆꯥꯕ ꯐꯠꯇ꯭ꯔꯒꯗꯤ ꯂꯥꯏꯔꯤꯛ ꯄꯥꯕꯒꯤ ꯀꯩꯁꯤ ꯂꯩꯔꯣꯏꯕ ꯑꯗꯨꯅ ꯑꯉꯥꯡꯁꯤꯡꯁꯦ ꯌꯥꯝꯗ꯭ꯔꯕꯗ ꯄꯨꯡ 10ꯗꯩꯅ 23-24 ꯂꯥꯏꯔꯤꯛ ꯄꯥꯖꯩ ꯑꯉꯥꯡꯁꯤꯡꯁꯦ ꯑꯗꯨꯅ ꯆꯥꯕꯁꯤꯗꯤ ꯐꯖꯅ ꯍꯥꯎꯅ ꯄꯤꯖꯔꯦ ꯑꯩꯒꯤꯁꯦ
ꯑꯗꯣ ꯔꯨꯝꯁꯦ ꯍꯥꯏꯗꯤ ꯁꯤꯒꯤ ꯍꯣꯁꯇꯦꯜ ꯕ꯭ꯂꯣꯛꯁꯤꯃꯗꯤ ꯍꯥꯏꯗꯤ ꯕꯤꯜꯗꯤꯡ ꯉꯁꯥꯏ ꯀ꯭ꯂꯥꯁꯔꯨꯝꯁꯤꯒ ꯄꯨꯟꯅ ꯑꯩꯈꯣꯏ ꯅꯨꯄꯤ ꯃꯆꯥ ꯉꯥꯛꯇ ꯂꯩ ꯍꯥꯏꯅ ꯍꯥꯏꯀꯣ ꯑꯩꯈꯣꯏ ꯀꯦꯄꯥꯁꯤꯇꯤꯁꯦ ꯔꯨꯝꯁꯦ ꯀꯌꯥꯃꯨꯛ ꯑꯣꯏꯗꯣꯏꯅꯣ ꯀꯌꯥꯃꯨꯛ ꯂꯩꯕ
23 ꯂꯩ
23 ꯑꯣꯏꯗꯣꯏꯅꯣ ꯑꯗꯨ ꯑꯣꯏꯇꯥꯔꯗꯤ 24 ꯁ꯭ꯇꯨꯗꯦꯟꯠꯁ ꯃꯨꯛ ꯂꯩ ꯌꯥꯗꯣꯏꯅꯦꯕ ꯑꯗꯨꯒ ꯕꯣꯏꯁ ꯍꯣꯁꯇꯦꯜꯒꯤꯗꯤ ꯀꯗꯣꯝ ꯅꯥꯀꯟ
ꯕꯣꯏꯁ ꯍꯣꯁꯇꯦꯜꯁꯤꯅ ꯕꯤꯜꯗꯤꯡꯁꯤꯒꯤ ꯅꯥꯀꯟꯗ ꯂꯩꯔꯦ
ꯍꯦꯛ ꯅꯥꯀꯟꯗ ꯂꯩꯗꯣꯏꯅꯦꯕ ꯑꯗꯣ ꯃꯈꯣꯏꯒꯤꯗꯤ ꯀꯦꯄꯥꯁꯤꯇꯤꯁꯦ ꯀꯌꯥꯃꯨꯛ ꯑꯣꯏ
ꯃꯣꯏꯁꯤ ꯔꯨꯝ 3 ꯈꯛꯇꯅꯦ ꯁꯤꯗꯤ
ꯑꯣꯀꯦ ꯔꯨꯝ 3 ꯈꯛꯇꯪ ꯑꯣꯏꯕ ꯌꯥꯝ ꯅꯨꯡꯉꯥꯏ ꯑꯗꯨꯒ ꯀꯤꯆꯟꯁꯨ ꯑꯗꯨꯝ ꯁꯦꯝ ꯕꯤꯜꯗꯤꯡꯗ ꯑꯣꯏꯔꯕꯅꯤꯅ ꯌꯥꯝ ꯅꯨꯡꯉꯥꯏꯔꯦ ꯍꯥꯏꯇꯥꯔꯦ
ꯂꯥꯏꯕ꯭ꯔꯦꯔꯤꯁꯤ ꯑꯗꯨꯝ 24 ꯑꯋꯥꯔꯁ ꯄꯥꯕ ꯌꯥꯏ ꯁꯦꯝ ꯕꯤꯜꯗꯤꯡꯗ ꯑꯣꯏꯕꯅꯤꯅ
ꯑꯣꯀꯦ ꯑꯗꯣ ꯑꯣꯖꯥꯗ ꯍꯪꯖꯅꯤꯡꯕ ꯑꯃꯅ ꯉꯁꯥꯏ ꯑꯣꯖꯥꯒꯤ ꯃꯐꯝꯁꯤꯗ ꯉꯁꯥꯏ ꯑꯦꯛꯖꯥꯝꯁꯤ ꯄꯥꯁ ꯇꯧꯕ ꯉꯝꯗꯗꯅ ꯂꯥꯛꯆꯕ ꯍꯥꯏꯗꯤ ꯋꯤꯛ ꯑꯣꯏꯕꯒꯤ ꯄꯣꯏꯟ ꯈꯔ ꯋꯥꯠꯄꯗꯒꯤ ꯃꯥꯔꯛ ꯈꯔ ꯋꯥꯠꯄꯗꯒꯤ ꯄꯥꯁ ꯇꯧꯕ ꯉꯝꯗꯅ ꯂꯥꯛꯈꯤꯕ ꯁ꯭ꯇꯨꯗꯦꯟꯠ ꯈꯔꯗꯤ ꯃꯐꯝꯁꯤꯗ ꯂꯥꯛꯄꯗꯒꯤꯗꯤ ꯃꯥꯏ ꯄꯥꯛꯆꯕ ꯃꯌꯥꯝ ꯌꯥꯎꯔꯦ ꯍꯥꯏꯇꯥꯔꯦ ꯃꯈꯣꯏꯁꯦ ꯃꯥꯏ ꯄꯥꯛꯑꯦ ꯇꯥꯕ ꯃꯇꯝꯗ ꯑꯣꯖꯥ ꯏꯁꯥꯒꯤ ꯊꯃꯣꯏꯗ ꯐꯥꯎꯕꯤꯕꯗꯣ
ꯇꯁꯦꯡꯅ ꯑꯩꯁꯤ ꯄꯔꯤꯈꯥ ꯍꯥꯏꯗꯣꯛꯄ ꯅꯨꯃꯤꯠꯁꯦ ꯍꯟꯗꯛꯁꯤ ꯌꯥꯝ ꯊꯨꯅ ꯍꯥꯏꯗꯣꯛꯔꯛꯑꯦ ꯌꯥꯝ ꯊꯨꯅ ꯍꯥꯏꯗꯣꯛꯄꯁꯤꯗ ꯄꯔꯤꯈꯥ ꯍꯥꯏꯗꯣꯛꯄ ꯅꯨꯃꯤꯠꯁꯤꯗ ꯑꯩꯈꯣꯏꯗꯤ ꯁꯤꯒꯨꯝꯕꯗ ꯑꯗꯨꯝ ꯑꯦꯛꯇꯤꯚ ꯑꯣꯏ ꯂꯩꯕꯅꯤꯅ ꯗꯦꯜꯂꯤꯒꯤ ꯑꯩꯒꯤ ꯑꯣꯖꯥ ꯑꯃꯅ ꯆꯥꯂꯣ ꯃꯦꯁꯦꯖ ꯊꯥꯔꯛꯑꯦ ꯄꯥꯁ ꯑꯦꯛꯖꯥꯝ ꯍꯥꯏꯗꯣꯛꯑꯕꯅꯤꯅ ꯑꯩꯁꯤ ꯕꯤꯡ ꯂꯥꯎꯋꯦ ꯑꯍꯥꯟꯕꯗ ꯑꯗꯨꯗꯩ ꯑꯩꯒꯤ
ꯑꯩꯈꯣꯏ ꯀꯌꯥꯝ ꯌꯥꯎꯔꯝꯒꯗꯣꯏꯅꯣꯅ
ꯑꯗꯩ ꯑꯩꯒꯤ ꯑꯉꯥꯡ ꯃꯌꯥꯝꯒꯤ ꯔꯣꯜ ꯅꯝꯕꯔꯁꯦ ꯑꯩꯈꯣꯏꯅ ꯂꯣꯏꯅ ꯐꯣꯔꯝ ꯐꯤꯜ ꯑꯞ ꯇꯧꯕꯅꯦ ꯂꯣꯏꯅ ꯏꯔ ꯊꯝꯃꯦꯕ ꯖꯔ ꯌꯦꯡꯊꯔꯛꯄ ꯀꯥꯟꯗ ꯑꯉꯥꯡ 13ꯀꯤ ꯌꯦꯡꯕ ꯀꯥꯟꯗ ꯑꯉꯥꯡ 9-10 ꯌꯥꯎꯁꯤꯗ ꯑꯩꯁꯦ ꯋꯥꯈꯜ ꯅꯨꯡꯉꯥꯏꯕ ꯍꯧꯔꯦ ꯀꯩꯒꯤꯅꯣꯗꯤ ꯃꯅꯤꯄꯨꯔꯒꯤ ꯑꯆꯧꯕ ꯏꯅꯤꯁꯤꯌꯦꯇꯤꯚ ꯑꯃ ꯂꯧꯔꯦ ꯑꯩꯅ ꯑꯆꯧꯕ ꯃꯅꯤꯄꯨꯔꯒꯤ ꯁꯥꯇ꯭ꯔ ꯑꯃ ꯕꯨꯁ ꯇꯧꯔꯦ ꯀꯥꯏꯅ ꯈꯟꯖꯩꯌꯦꯕ ꯑꯩ ꯌꯥꯝ ꯍꯔꯥꯎꯖꯈꯤ ꯑꯗꯨꯒꯤ ꯃꯇꯨꯡꯗ QRS ꯍꯥꯏꯅ ꯄ꯭ꯔꯣꯒ꯭ꯔꯥꯝ ꯑꯃꯁꯨ ꯇꯧꯋꯤ QRSꯗꯩꯅ ꯑꯉꯥꯡ 13-15 ꯌꯥꯎꯋꯦꯕ ꯑꯗꯨꯅ ꯁꯤ ꯌꯥꯎꯔꯤꯁꯤ ꯃꯅꯤꯄꯨꯔꯒꯤ ꯐ꯭ꯌꯨꯆꯔ ꯗꯣꯛꯇꯔ ꯉꯥꯛꯇꯅꯤ ꯑꯗꯣ ꯇꯁꯦꯡꯅ ꯊꯥ 3-4 ꯈꯛꯇꯪ ꯁꯤꯗ ꯂꯩꯔꯒ ꯐ꯭ꯌꯨꯆꯔ ꯗꯣꯛꯇꯔ ꯑꯃ ꯄ꯭ꯔꯗꯛ ꯇꯧꯕꯒ ꯆꯞ ꯃꯥꯟꯅꯩ ꯑꯗꯨ ꯌꯥꯝ ꯍꯔꯥꯎꯖꯩ ꯌꯥꯝ ꯅꯨꯡꯉꯥꯏꯖꯩ ꯑꯗꯣ ꯁꯣꯝ ꯆꯤꯡꯖꯥꯃꯩ 360ꯅꯒ ꯂꯥꯛꯄꯤꯔꯒ ꯁꯨꯕꯤꯔꯒ ꯇꯧꯕꯤꯔꯤꯁꯤꯁꯨ ꯌꯥꯝ ꯍꯔꯥꯎꯖꯩ
ꯑꯗꯣ ꯑꯣꯖꯥ ꯑꯩꯈꯣꯏꯅ ꯍꯪꯖꯅꯤꯡꯕꯁꯤ ꯂꯣꯏꯁꯤꯜꯂꯛꯄꯗꯀꯣ ꯑꯣꯖꯥ ꯉꯁꯥꯏꯒꯤ ꯑꯉꯥꯡ ꯅꯦꯠ ꯑꯃꯨꯛ ꯇꯠꯈ꯭ꯔꯦ ꯀꯩꯁꯨ ꯌꯥꯝ ꯀꯩꯅꯣ ꯇꯧꯗꯦ ꯅꯠꯇꯦ ꯍꯜꯂꯣ ꯑꯣ ꯌꯥꯔꯦ ꯑꯣꯖꯥ ꯑꯩꯈꯣꯏꯒꯤ ꯅꯝꯕꯔ ꯑꯣꯐ ꯀ꯭ꯂꯥꯁꯦꯁꯇ ꯆꯠꯄ꯭ꯔꯥ ꯀꯃꯥꯏꯅ ꯇꯧꯋꯤ ꯑꯝꯇꯪ ꯊꯝꯕꯤꯌꯨ
ꯃꯁꯤ ꯁꯕꯖꯦꯛ 53ꯅꯦ ꯁꯕꯖꯦꯛ 53ꯁꯤ ꯂꯣꯏꯅ ꯇꯧꯋꯦ ꯁꯤꯗ
ꯃꯥꯏꯀ꯭ꯔꯣꯐꯣꯟꯁꯦ ꯍꯟꯗꯛꯀꯤꯁꯤꯅ ꯍꯜꯂꯣ ꯃꯌꯥꯝ ꯁꯥꯎꯟ ꯇꯥꯕꯤꯕ꯭ꯔꯥ ꯑꯝꯇꯪ ꯍꯥꯏꯕꯤꯔꯛꯑꯣ ꯑꯣꯖꯥꯒꯤ ꯁꯥꯎꯟꯗ ꯑꯝꯇꯪ ꯍꯥꯏꯕꯤꯔꯛꯑꯣ
ꯍꯜꯂꯣ
ꯍꯥꯏꯕꯤꯔꯛꯑꯣ ꯑꯣꯖꯥ
ꯇꯁꯦꯡꯅ ꯃꯁꯤ 19 ꯁꯕꯖꯦꯛꯅꯤ 19 ꯁꯕꯖꯦꯛꯁꯤ ꯂꯣꯏꯅ ꯀꯣꯚꯔ ꯇꯧꯒꯅꯤ ꯁꯤꯗ
19 ꯁꯕꯖꯦꯛ ꯀꯚꯔ ꯇꯧꯕ
ꯍꯣꯏ ꯑꯗꯣ ꯑꯣꯖꯥꯁꯤ ꯁꯕꯖꯦꯛ ꯋꯥꯏꯁꯀꯤ ꯑꯣꯏꯅ ꯑꯣꯖꯥ ꯂꯥꯛꯆꯩ
ꯁꯕꯖꯦꯛ ꯋꯥꯏꯁꯀꯤ ꯑꯣꯏꯅ ꯑꯣꯖꯥ ꯂꯥꯛꯄ ꯈꯔ ꯍꯧꯅ ꯍꯥꯏꯕꯤꯔꯛꯑꯣ
ꯁꯕꯖꯦꯛ ꯋꯥꯏꯁꯀꯤ ꯑꯣꯏꯅ ꯑꯣꯖꯥ ꯂꯥꯛꯏ ꯁꯕꯖꯦꯛ 53ꯒꯤ ꯑꯣꯖꯥ 53 ꯂꯥꯛꯀꯅꯤ ꯑꯗꯣ ꯑꯩꯈꯣꯏꯁꯤ ꯁꯕꯖꯦꯛ ꯑꯃ ꯂꯣꯏꯔꯦ ꯐꯣꯔ ꯑꯦꯛꯖꯥꯝꯄꯜ ꯍꯧꯖꯤꯛ ꯁꯔꯖꯔꯤ ꯇꯥꯏꯁꯦ सर्जरी से ताकु लोरगा सर्जरी से ताकु लोर चक्रनी ओजा अमा दुगा डेट 18 दगी ओजा अतोपा अमा लाने अदुना बायोकेम फिजियोलॉजी ओजा अमा लाने
ओके हाइदि ओजा से मथंग मथंग
मथंग
लाखबै वानेबा
रूटीन वाइज ता दुम लाइग्रे ऑल ओवर इंडिया ने सनाय काना सिदे सर्जरी ताकु कांदा दिल्ली दना अतोपा सब्जेक्ट तायबा अदु सी रोटेशन वाइज ता दुम सेम अखोगी इंडिया के लाइबे इंस्टीट्यूट में रोटेशन वाइज ता सेम हाइदा
अदो ओजादा हंजनिंग बमना मसागी कनो से कोर्स की फी है तारे कोर्स की फी से क्या मोय अदु सी में थ्री सिंग मिंग पंगर मतबना कया मु डिस्काउंट पीबी दोय दो
अखोई सी 40-45 से में लवे अदु तसेना सिंजंग 360 दगी लाको तारगदि कोई 10% डिस्काउंट पीजगनि
10% डिस्काउंट में अनाउंस तौबीरे मसिदा याम गाइरे मैं मफम से लाकपिरगा अदो स्टूडेंट जो बिन तौबी मतमदा 10% डिस्काउंट पीबीगनि हाइबे अनाउंसमेंट सि मसु लेरे लोसलकपदा ओजा मणिपुर की मियाम हाइ टाइम मरुइना अखोगी MCI की एग्जाम की FMGE एग्जाम से पास तौब ngamjadaba family mahiro sing hai tare ko makoi family sing da kari wafam adi thamini
tasena FMG pass tau da bede yum da leigdi sau pudi sida lakpiraga coaching asi yaubiraga aikoina amba mating pangjage adu tasena kana gumba paisa ware khole upai leijida ha so aina amba mating pangjaraga mai partner bagi lambena changsan mina se haibagi message se tawningi adu mathakta amaka kana gumba satra foreign do juji tammiba adagi tamba sakada leiraga so adu gi sai full support tawjage 5 years full support tawjage aduga kana gumba angang vacation thogapra so class yaujage ha ga free of course ta yauhanjage
adi hojiki class
yauning hoji sanaigar foreign da tami bangang sing suti vacation ji tha ani mu oi bane
hoi hoi
adu vacation ji thok kanda free of course ta yauhanjage
pesa yam ngai na lojaro okay yam ngai ngasi su wajana su matam na kai thokpiraga hai tare ko AFMG koi Academy for Foreign Medical Graduates haina hangdokchari ba koi mafam asida mayam na su koi mafam na khaidi mayam ga wari watai sabagi tanja ama pinabiba loina first ever FMGE exam MCI next coaching institute in Northeast India da ya hanba oi ga doini so haina takpire ko mayam sigi si koi yam nungai hai tare aduna su Manipur da koi gi ahanba coaching center oiba khatana tana Northeast India da su mayam ahanba coaching center ma oi mafam sida mayam lengsen biraga Manipur da koi mapan da koi foreign countries sing da koi graduation hai tare koi medical line graduation tam loiraga mayam exam pass taw ngam da na laiba sing adu kamaina preparation taw ga kaina ga khallaga laiba koi sing na doctor sing du su mayam mafam se lapaga koi awara passing mayam tanabiyu aduga fees ki matang da leraga sudum takso tasen taroga awara passing tanabiyu hai base sing metric mai kadi thamjage aduga koi mafam asida koi na announce tawjari ba hai tare AFMG Academy for Foreign Medical Graduates sisu makoi na hona bi rakwa thabak thoram khudi makta su mai pak ko sanu hai na sing metric mai kai dagi wish tawjari mafam sida mukan han thai jage koi 24/7 library service pibi bani ko free wifi su piri aduga hostel for both boys and girls su piri tongan tongana adu offline and online classes su leire local system su leiba loina library system su leiraga sumaina koigi lairik pananabagi mafam sing su marang kaina thambiraga koi watta pada institute amasu oiri habagi nungai pau sima thamjani man loina na singmechi sigi koi ngasi thadok chariba live asida hapchariba mobile number ani sida mayam any khangning ba makhata na support longning ba leiraga su mayam mafam se laga support lobiu number sida call taw support hangbiro hai mafam se thamja loina da matang se live solution jawi ta ja lobiner sira
yan nungai re noi lakpi yan nungai je thank you very much
mayam thagachari